Okay, I think that we can start now because we're a little bit after 8 o'clock. People will still be coming into the room, and my wonderful colleague, Marianne Delaporte Kabir, is going to be letting people in. She's also here to help if anyone has any issues with slides or technical issues. So, good morning to everybody who's here. My name is Anna Hennessey, and I am the founder and the director of the Society for the Study of Pregnancy and Birth. Um, we've had a wonderful year. We received a lot of abstracts for this event, and we're just very excited to be putting it on over the next 3 days. So I have a few short welcoming remarks, and then we're going to jump right into our co-keynote speech. And if anyone has any questions, you can also put them in the chat for us. Okay, so we're excited to have a wide range of scholars, artists, researchers, midwives, care workers, and others joining us this year from all around the world. This year's symposium centers on the theme of beauty and the sublime in gestation and coming into being, art and the aesthetics of pregnancy and birth. So, over the next 3 days, we're going to delve into a wide range of topics regarding this theme. So, the gathering, it's designed not just for presenting findings, but to foster deep intellectual exchange, spark new collaborative research, and challenge us to push the boundaries of the field. And I should say that for those who came to our 2025 symposium last year, which was our first one, a lot of collaborations have come out of that. And it's looking like we actually have an anthology that's going to be published from Springer Nature related to the topic of natality. And we'll post more about that on our newsletter. So before we begin, I'd like to extend my deepest gratitude to a number of individuals and groups without whose help this event would not have been possible. So first and foremost, I thank all of you, the participants, for sending in your work. It's been fascinating reading all the abstracts. And you are really the heart of this event. Um, I I thank those who helped out as part of our abstract review team, and those include Doreen Balabanov, Martina Heinen, Beatrice Sasha Kobo, and Cassandra Shortino. Okay. The event also would not have been possible without the help of our moderators and symposium facilitators, who include Marianne Delaporte Kabir, Martina Heinen, Beatrice Sasha Kobo, Swan Martok, Adewale Onagbasan, and Sarah Rundstrom. Additionally, we thank Swan Martok for her help in securing our keynote speakers last year, and Anthony Bocelli Estrada for his behind-the-scenes technical help and suggestions for the virtual symposium. This year, we're deeply grateful to have Lauren Bice and Sheila Lintott serving as our 2026 co-keynote speakers, both of whom I'll be introducing shortly. And finally, we thank all of our Society's advisory board members for their willingness to serve on the board and for their continued support of the Society. So before we begin the discussion, the keynote discussion, here's some brief housekeeping rules related to how the keynote panel and session will run, especially since we're using Zoom. So for all of our sessions, our speakers will first deliver their presentations, then we will have some time for questions from audience members. Make sure that your mics are muted when our presenters are talking. So last year we used a webinar format, which meant that we didn't have to mute people. This year we're using a regular Zoom meeting. So please make sure that your mics are muted. And our moderators will mute the mic or ask you to mute it if we hear the noise. So during the Q&A, you can either raise your virtual hands or your actual hands in your screen, or you can feel free to put a question in the chat and the moderator will read that out. We're recording the symposium, but the presenters, they'll all have the opportunity to opt out of having their recording made public. We make all our recordings into videos that we put on our YouTube channel. But again, all participants do not have to do that if they don't want to. Um, so when our sessions end, the Zoom recording will keep going. But during that time, you can just feel free to mute yourself, block your image and have some coffee, um, or get something to eat. And oh, one other thing is that regarding the timing of the papers, not the keynote, but the other regular papers, that it's 15 to 20 minutes. And Marianne and I, one of us will probably at the 15 mark just say 15. We really don't want to interrupt you, but we just want you to know where you stand with the time. So you'll just hear 15 when you get there. And that means you have a few minutes left. So we understand that attendees are coming from all around the world, and we don't expect everyone to come to every single session. Just come to the sessions that you're able to based on your time zone. So without further ado, and to officially open our proceedings, it's now my privilege to introduce our co-keynote speakers, Lauren Bice and Sheila Lintott, who will be delivering their keynote speech on the topic of aesthetics, care work, and loss. Lauren N. Bice, Doctor of Nursing Practice and Certified Registered Nurse Anesthetist, serves as Chief CRNA for the General Anesthesia Division of the Department of Anesthesiology and Critical Care Medicine at the Children's Hospital of Philadelphia. With more than 17 years of nursing experience, including neonatal intensive care nursing, pediatric anesthesia, and education, she is passionate about developing future CRNAs and nursing leaders through teaching and mentorship. Dr. Sheila Lintott is a professor of philosophy, affiliated faculty in women's and gender studies at Bucknell University, where she has taught and researched feminist issues since 2006. She has edited 3 books, 2 on motherhood and 1 on nature aesthetics, and is the author of numerous journal articles and book chapters on such topics as feminist philosophy, philosophy of art, the aesthetics of nature, humor and comedy, and philosophy of friendship. So I'm now going to turn this over to them.
Yeah, absolutely.
Okay, well, welcome and thank you so much.
Yeah, thank you. Good morning, good afternoon, realizing that we have participants from all over the country and all over the world. I'm honored and excited to be here, so thank you for inviting us to share some of our knowledge with you today. Specifically, I want to thank Anna for organizing this event. All members of the Society for the Study of Pregnancy and Birth, and to all the conference participants. Thank you so much for the introduction. And as Anna stated, I am Lauren, currently practicing as a nurse anesthetist at Children's Hospital in Philadelphia. I'm honored to be co-presenting with Dr. Sheila Lintott, professor of philosophy at Bucknell, who also happens to be my aunt. So we go way, way back. So as stated, our keynote today is going to focus on aesthetics, care work, and perinatal loss. So I think it's really important in talking about birth to acknowledge the idea that loss can also occur. So before we dive too deep into the topic, just want to give a little bit of a content warning because the topic of perinatal loss can be challenging to people that have directly or indirectly experienced this in their lifetime, whether personally or professionally. I think it's pretty common knowledge that, the quote that, parents shouldn't bury their children. It's a widely shared sentiment. It's devastating to lose any child, and any loss of that kind can wreak havoc on a parent and family's lives. And generally, I think the assumption is that the younger the child, the more devastating the loss is, which is not necessarily true. But going along with that fact, it's interesting that the severity of perinatal loss or loss during pregnancy, whether it's during the gestation period or within that first month of life, is often underappreciated and sometimes wholly like unacknowledged altogether. So there have been incredible medical advances in the screening, treatment, and also diagnostics of, you know, whether it's a genetic syndrome or a diagnosis that can lead to perinatal loss. And believe it or not, roughly 30% of pregnant women do experience some degree of perinatal loss. And again, this can include miscarriage, stillbirth, and neonatal death. And these things, the definitions are centered around gestational age and timing of that loss in relation to delivery. Um, the causes of death are quite varied. Some of them are entirely unanticipated, which is often more challenging in the grieving process. But some of them are imminent based on, again, the advancement in diagnostic screening with the advances of medical technology. Regardless of how the loss is experienced, perinatal loss is really complex and quite difficult. In addition, it's important to acknowledge like the secondary victims as well. So the loss that is experienced by extended family members and also the medical professionals that are attending these losses. Those individuals also must find their own way to process the trauma of experiencing it, but also the feeling of not being able to prevent these losses and deaths. So perinatal loss results in what is more commonly defined as complicated grief, which the formal definition it says it's characterized by persistent searching and for remembrance of the deceased, as well as an intense and distressing emotions. And it's marked by an inability to release the death psychologically, as well as integrate this into the individual and family's life moving forward. There's a multitude of symptoms that complicated grief can manifest as. Um, it can last for upwards of 5 to 10 years and even longer for some individuals. And this includes like emotional dysregulation, sadness, anxiety, physical pain, actual illness such as cardiovascular disease, diabetes, substance abuse, sleep disturbances, alterations in relationship, social isolation, changes in interpersonal relationships and avoidance of interpersonal relationships altogether, and even suicide. So, more simply stated, the suffering of complicated grief after a perinatal loss, or really any loss, really does ruin lives. Um, and upwards of 30% of parents who suffer a perinatal loss will experience some degree of complicated grief. So in this presentation, we want to discuss our objectives are going to be to talk about the nature of aesthetics, the nature of grief, the role of aesthetics in grief, how medical professionals can help parents confront and begin to process the intense pain and perinatal loss by offering some aesthetic resources in these situations. So before we dive into this, I think it's important to talk about a little bit, what is aesthetics? And again, it's in a relationship with perinatal loss and the grief process. Um, Aesthetics was coined in 1758, actually. It's the science of or sense of cognition or the discipline of thinking with beauty. Over time, this term really has been understood a little more narrow than what was previously thought. I think it's most often associated with art, whether this is fine art or mass art, or just the process of beautification, whether it's a person, place, or a thing. But really, in a broader sense, aesthetic refers to the wide range of experiences that are cultivated in every area and every aspect of life. And these are experiences that shape how we interact with the world through our senses and awareness of such interactions. On a more broader sense, the idea of aesthetics has been brought in to include any reaction we form towards the senses or design qualities of really any phenomenon, object, or activity. again, in a broader or more richer sense, it's a theory of perception in the fullest sense of the term, in which perception is understood as the experience of the presence of persons, objects, and or environments. Um, so understanding this, the aesthetic aspects of our lives can actually be positive or negative, or saying that experiences can be one of beauty or one of ugliness. And those two things, beauty or ugliness, are equally aesthetic. Aesthetic experiences may prompt us to act rather than or by passing judgment or making conscious evaluations. Um, Aesthetics function in everyday life. They cue us to act. For example, when you experience a pile of dirty dishes in your sink, um, it is the aesthetics of that that prompt you to start washing them, or how to react if you see a cute animal, a dog or a cat, and you want to pet them and experience their soft fur. So again, aesthetic experiences occur in all areas of life. So as previously stated, the obvious expression of this is appreciating or creating art, but it also occurs through our everyday lives. For example, if you were like hosting a party, and you want to work really hard to ensure that all of your guests have great food to eat, drinks to drink, there's comfortable surroundings that are conducive to conversation and a fun social outing. The host is going to spend time and energy and resources to improve the aesthetic experiences of that event. Just like we want to improve the aesthetic aspects of our lives, from what we wear, to the style and the color of the car we drive, or how we care for our lawns and our gardens. Um, our lives are full of aesthetics in the form of our individual preferences, decisions, experiences, and much, much more. Our lives, each and all of our lives, virtually all the time, are full with elements that help structure, define, and create us. And it's how they also shape how we interact with others. Um, Conversely, the consequences of some of our aesthetic choices are actually quite serious. If you want to think about the example of the impact of lawn care, we're using precious resources, but also quite dangerous chemicals to cultivate our lawns. And then also the health aspect. People that really work hard to get their bodies into shape. It can start with excessive exercise, but it progress to quite extreme medical interventions. So really, and also the social impacts that of the public spaces that we either fortunate or are fortunate enough to populate. So the outreach of aesthetic preferences or experiences go beyond the individual to involve broader society. So really, the topic of this actual conference, which is pregnancy and birth, is really in many ways the perfect site of inquiry for aesthetics. In the Kayada Mandoki makes this clear connection that she has found between aesthetics and motherhood when she talks about the bonding between an infant and a child in the act of nursing. She talks about the act of nursing. It's the experience from which all of our future aesthetic experiences take root. She suggests that we understand actually all of our future aesthetic encounters metaphorically as latching onto an aesthetic object, as being nourished aesthetically by those objects. Her discussion of aesthetics and latching on begins with the perspective of the infant, but she continues to say, not only since we're born, but also when we wake up every morning, at each and every moment of each and every day, we're seeking objects for latching onto. I'm going to pass over to Sheila for the next portion.
Okay. Okay, so we're going to talk a bit about grief now. And of course, it's a familiar emotional experience, but its nature and value are not really well understood culturally in the West. We don't really talk about grief, and it's seen as something to be avoided, despite the fact that it is unavoidable. Of course, the stages of grief articulated by Elizabeth Kubler-Ross in her well-known book on death and dying, denial, anger, bargaining, depression, and acceptance are well-known and illuminating, and they provide the solace that comes with the realization that your experiences, however intense and uncomfortable, are normal. But still, there's more we should want to know and understand about grief, including its value, importance, and meaning. So obviously grief is intimately tied with loss, and often the loss that comes with the death of a loved one, but it can come with many losses, almost any aspect of life. Losing something important to you, especially future looking, can cause grief. And grief reminds us that what we care about, what we believe we have, and even feel entitled to can be lost. It reminds us of our vulnerability, and that's something, admittedly, we like to avoid thinking about whenever we can. So whether grief itself is an emotion or more like a series of processes that involve emotion is a matter of disagreement among theorists. But in any case, there are definite similarities between emotion and grief. Both are object-directed, affective reactions to specific things and dependent on cognition. Fear, for example, is directed at the formal object of the dangerous and involves a negative affective response and prompts us to act, right? To get away from whatever we fear or try to eradicate whatever we fear. So, for example, my fear of rats is felt at the sight of a rat because I believe that rats are disease-ridden monsters. So like emotion, grief is an affective reaction to something specific. Preston Roeder explain, when someone grieves, she is sad about some specific loss, something, for example, the death of a parent, the breakup of a marriage, the dissolution of some organization with which she was deeply committed. And it's intertwined with cognition, as is most perhaps clear in the denial and acceptance stages of Kubler-Ross's outline. The denial stage involves the struggle to accept the permanence of the loss, cognitively, emotionally, and existentially. The sorts of serious losses that cause grief are not easy to get your mind around, and the mind will work ferociously, in fact, to fight it, right? To try to find ways to reject the reality presented. Acceptance is rarely quick and can be understood as us arriving at a mental state that no longer cognitively denies the unfortunate reality, despite wanting it to be otherwise. This aspect of grief is sometimes called grief's belief contrary nature. In grief, one strongly desires something contrary to reality. Now, we often find ourselves wishing things could be contrary to reality, but the desire for the unreal in grief is both stronger and stranger than wishing. Robert Solomon emphasizes grief's belief contrary nature, explaining that the paradoxical desire it involves. The desire is that the lost loved one not be lost, that he or she should appear, perhaps walk through the door in the next few minutes, despite the belief that he or she is dead. Grief involves the turmoil of an impossible desire, an inability to accept the loss, and the persistent demand that it not be so. So the process of grieving, of coping with that, is the process of coping with that impossible desire and intolerable loss. So this paradoxical desire is undoubtedly part of the unique pain of grief. Grief is deeply personal, tied to memory, and explicitly future-oriented. As Radcliffe and Richardson explain, it involves the loss of certain possibilities that were integral and perhaps even central to the unfolding of the structure of one's life. We don't grieve every loss, because not every loss is tied to our own understanding of ourselves and our values and our desires. As Tolby puts it, that's the quote right now on the slide, we grieve those in whom we have invested our practical identities, which helps explains the sense of finding oneself unfamiliar and the world around oneself disorienting. The individuals we grieve for are in some way vital to our understanding of who we are and what matters to us. They have been incorporated into those understandings and play critical roles in our practical identities. When they die, then, their death represents a threat to a dimension of us. A part of ourselves has non-literally been lost, a practical or ethical part. So when someone in whom we have invested our practical identity dies, our self-conception can be shaken, sometimes dramatically. In an excellent article called Falsely, Sanely, Shallowly, Reflections on the Special Character of Grief, Janet McCracken gives an account of grief that is illuminating and potentially instructive when we think about how to grieve well. McCracken argues that purely subjective accounts of grief are inadequate. Grief, she tells us, is objective in an important and distinctive sense. As we've already discussed, it is object-directed, and so therefore objective in that way. But she goes beyond what we've already said, revealing the dedicatory or honoring nature of grief. A person who is grieving recognizes her grief as not being just about or of the object she has lost, but for the object, for the lost object. She experiences her grief as dedicatory, as an offering. Robert Solomon captures the objective nature of grief when he characterizes it as an engagement with the world, the recognition of a real loss in one's world. For McCracken and Solomon, grief is experienced by the griever as an apparently objective loss. That's a loss that others will, or at least should, acknowledge and appreciate. And our grief is dedicated to that loss and to the person lost. In addition to its distinctively apparently objective nature and its dedicated nature, McCracken and others suggest that grief is experienced as obligatory. And McCracken is not alone. And you are likely in agreement as well. Consider someone who has suffered the sudden loss of a close family member and imagine they seem unaffected by the loss, navigating the mandatory public rituals with emotionless ease and returning immediately to fully function in their everyday lives. We suspect that you would speculate that either the allegedly grieving person did not truly value the person or have real hopes for a future with them in their lives, or that the person is in complete denial of the reality of the loss. In other words, you might suspect the person is failing their lost loved one or failing themselves. Solomon connects the obligation to grieve to honoring the dead by satisfying their desires, among which he says is almost certainly to be missed when I am gone. Solomon dismisses those who may find such a sense of obligation irrational or overly sentimental as insensitive souls who fail to appreciate that the essential nature of grief is not just an experience of loss, but the continuation of a relationship. So if there is a felt obligation to grieve, is there likewise an obligation, either felt or formal, to assist or at least not frustrate others in their grief? Although we don't fully defend the claim here, we do believe that such an obligation exists, and we believe it's rooted in relationships and roles. So if a friend is grieving, we ought to support them through the process. And if someone is under our professional care and grieving, we ought to likewise support them. In both cases, we should do what we can to ensure as well that we don't complicate or make more difficult the other's grieving process. In her groundbreaking book on complicated grief, called The Treatment of Complicated Mourning, Therese Rando confronts losses that are particularly difficult to process and offers analysis of and guidance for the grief process. Her work although it was published in 93, it's central to much of grief theory today. Rando explains that in all forms of complicated mourning, there are attempts to do two things: to deny, repress, or avoid aspects of the loss, its pain, and the full realization of its implications for the mourner, and to hold on to and avoid relinquishing the lost loved one. She outlined 6 phases someone experiencing complicated grief needs to navigate, the 6 R's of mourning: recognize, react, recollect, relinquish, readjust, and reinvest. So recognizing involves, acknowledging, coming to terms with the reality of the loss. Reacting is feeling and expressing the range of emotional and cognitive and social reactions that are triggered by the loss. Recollecting involves remembering the person who died, sharing stories about them, remembering special times with them or funny stories, allowing yourself to really feel the significance of the relationship and to identify and mourn any secondary losses. Relinquishing involves letting go of the roles, identities, or assumptions that were tied to that relationship and the continued existence of that person. Readjusting comes later, and it's slowly adapting to life without the person. We would move adaptively into the new world without forgetting the old world. developing a new relationship with the deceased and new ways of being in the world, and working to establish a new identity. And then finally, reinvesting, which is beginning to connect in the new world, forming new relationships, new interests, activities, setting new goals. So for Rando, complicated grief refers to any psychological, behavioral, social, or physical symptom, alone and in combination, which in context reveals some dimension of compromise, distortion, or failure in one or more of the 6 R's of the process of mourning, with the implication being that what has become complicated can be uncomplicated. We find these phases of the grief processes to be valuable as a resource for those who are grieving and those who are supporting those who are grieving. Okay. So now I'm going to talk a bit about the connection between grief and aesthetics. It might seem strange to bring aesthetics and grief together, but it really shouldn't. Aesthetic interventions in the form of poetry, music, floral arrangements, eulogies, memorials, stories, photographs, repasts, and more are abundant in the rituals and traditions through which we come together to honor and bid farewell to our deceased loved ones. The more one reflects on it, the more aesthetics appear to be central to grief and mourning, and the mourning through which we express and share it. Think of how we comfort others with offers of firm hugs, maybe mass remembrances, thoughtful sympathy notes, home-cooked meals. All of these things involve attention, creative activity, and intention to how the other will experience our offerings in an aesthetic sense. So in her recent book, 2024, Kathleen Higgins, the book is Aesthetics in Grief and Mourning. Kathleen Higgins offers a phenomenology. Interestingly, Kathleen Higgins is the widow of Robert Solomon. This offers a phenomenology of grief and explores the aesthetic resources that help reorient and reconnect us during it. She identifies key phenomenological features of grief, such as disbelief and disorientation, spatial confusion, temporal disturbances, disrupted or loss of motivation, altered sense of self, guilty feelings, and social alienation. She admits that experiences of grief are idiosyncratic, but we find that these features that she highlights resonate with our own experiences of grief. And although there will be personal and cultural differences, and each and every loss will involve distinctive issues, implications, and difficulties, it's likely that as humans, we will share a good deal of what constitutes grief experiences. And as she argues, aesthetic resources can be helpful. They can help us ground us in the process of recognizing loss and reorienting ourselves in an unfamiliar world without our deceased loved one. As it might be familiar to many of you, attending to our sense perception is a valuable coping mechanism that's used in many therapeutic contexts whenever emotional regulation is needed. So for example, after a loved one's death, simply holding and examining an object they used or loved can be extremely soothing. It's both its mere physical existence and its particular sensuous properties can help ground and reorient us, while also functioning as a memory prompt. Bereavement, as Higgins explains, highlights the factor that whatever other properties an object has, its tangible reality is not to be taken for granted. If the object was part of the deceased life, it now has a new value. It connects us to them despite their now permanent absence. This is why it can be so difficult to dispose of even trivial objects the deceased perhaps would have readily tossed in the trash. Higgins also warns that such objects can disturb the bereaved, making the deceased's absence felt all the more saliently. Yet even negative feelings have to be experienced rather than repressed. So even disturbing aesthetic experience has its value. In the context of grief, the value of art cannot be overestimated. Any artwork that expresses the feelings we are grappling with reminds us we are not alone, and it will allow for moments of connection when we feel most isolated. Music, for example, is a powerful and versatile artistic resource that allows us to apprehend our feelings in a more objective sense. They're sort of made external. Similarly, memoirs of grief and loss can be excellent company and support in a number of ways. As Rando explains, grief requires that we react to the loss by feeling and expressing the pain of the loss. And artwork might express what we feel only inchoately, chaotically, and confusedly, allowing us to begin to register and react to the lost. They can function as an emotional aid in the grief process when we feel alone or lost. And grieving is exhausting. And artworks that express the emotions we are feeling can do some of the sort of work for us, or perhaps better put, with us. A challenge to grieving well that Higgins talks about is the empathy gap, which is based in the experiential gap between the bereaved and those who lack comparable experience. Losing a loved one puts one in uncharted territory, and we can find great comfort in the knowledge that others too have navigated this unfamiliar and hostile world. Personally, I remember when my father died suddenly. I was in my early 20s, and none of my close friends had lost a parent. Most had never lost a close relative. Feeling alienated from the people with whom I was closest and who knew me best, for example, my college roommates, who happened to also be high school friends, so I knew them a long time, gave rise to feelings of bitterness, and the envy it only exacerbated the grief I felt. And I recall the surprising intimacy of the immediate bonds I experienced with even near strangers who I learned also lost a parent at a relatively young age. I still experience this today. If a student of mine, for example, loses a parent, which would have been about the time, college age, that I lost my father, just being with or being aware of these fellow travelers, even if I barely know them, gave me deep consolation. As Higgins argues, experiencing artworks, especially narrative works like films and memoirs, that give a sense of or afford a vicarious experience of grief can help bridge the gap, for example, that I felt between me and my roommates. I recall, in fact, weeping with friends through the film Shadowlands, which, if you've seen it, it's powerful. A film chronicling C.S. Lewis's relationship with and loss of his wife to cancer. And feeling understood by them in a way that I hadn't previously. Not exactly understood, but definitely closer. Another aesthetic resource concerns the spaces we inhabit and with whom we share them. Grief takes time, and so does aesthetic experience. So sharing space and time with a grieving person is an incredible gift of camaraderie, reminding them that we're there and helping them be present at moments when their mind might be endlessly replaying the past or worrying about the future. The spaces might be filled with music, for example, but quiet is also an important and aesthetic resource. Allowing a grieving person to simply be without having to say or do anything can assist them in the process of readjustment that is so difficult. Stories are another invaluable aesthetic resource in times of grief. So listening to the bereaved tell stories of their lost loved one, sharing your own allows for interpersonal connection. Through stories, the bereaved can recollect and remember who their loved one was and the relationship she shared with others and with herself. In fact, sometimes sharing a story about the deceased exposes something new or surprising about them, which can afford a grieving person an opportunity not only to re-experience the deceased, but also to realize the relationship that she had with them is not over. She's still learning new things about them, although the relationship admittedly is very different. We understand ourselves largely in virtue of the relationships and roles we play. The loss of a loved one, so thus, disrupts a sense of identity. So sharing these stories can help restore this identity and help the grieving person start to make a new identity. It's also well documented that the stress and pain of grief can deplete cognitive resources, and prolonged grief can lead to even more serious cognitive decline. So there are definitely important cognitive benefits to encouraging the bereaved to think through and give voice to their memories and how they feel about them. Feelings of abandonment after the death of a loved one can also be devastating. The bereaved may feel a pressing need to communicate with the deceased. In some cases, the bereaved may feel anger, feel like the deceased left them. So grave sites and other memorials are aesthetic resources that seem, at least, to open lines of communication with the deceased, perhaps allowing the bereaved to begin to relinquish the old attachments by expressing what needs to be shared and readjusting to life after loss. Leaving gifts, flowers, or other mementos for the deceased are gestures of intimate connection that can reduce the feelings of abandonment. And many therapists encourage grieving patients to make creative projects in honor of or dedicated to the deceased. Such projects, can take virtually any form, and they can allow us to share a whole host of thoughts and feelings, from inside jokes to, perhaps importantly, correcting regretted words or attitudes expressed in life. And therapists might also encourage grieving patients to find new aesthetic interests, whether in hobbies or finding new art forms to enjoy, and which is another aesthetic resource that can aid one in the very, very difficult process of reinvesting in life after loss. And now I will switch back to Lauren.
All right. Perfect. Um, so the last and final area that we're going to explore today talks about aesthetics, care work, and specifically tying that to perinatal loss. So the impact of medical professionals' words, behaviors, and actions is well documented in a number of studies. Pakayajit found that while some parents feel quite supported by medical professionals, some actually verbalized they expected a lot better. They expected more empathy, more attention, more patience, and more understanding than what they actually received. This is important to highlight because it's an area for medical professionals to grow in practicing or grow their awareness of how they're likely to be perceived by grieving parents and families, so they can mindfully confront themselves in appropriate ways. Um, so all of this requires both empathy and aesthetic awareness. The philosopher Nell Nodding expresses how caring for another is actually not a matter of following abstract principles or rules, but it's really important to relate to the care of that unique individual. For all caregivers who bear witness and accompany parents as they navigate a perinatal loss, can help these parents by meeting them where they are and facilitating their unique individual grief process by providing a wider range of aesthetic resources and interventions. It's also important to note that not all of these offerings are desirable to all parents. So this is something that's expected and should be accommodated. It's important to recognize the singularity and also the wholeness of each grieving individual. And hospitals should really prioritize the training and be able to empower their staff and medical professionals with the skills and freedom to interact with bereaved parents and families in compassionate ways during these early moments of devastating loss. There's a nonprofit organization that focuses on perinatal bereavement care. It's called Resolve Through Sharing. And their research shows that what parents actually remember most are the moments that they have with their baby. And believe it or not, the behaviors and actions of healthcare professionals, whether or not they are positive or negative. So medical professionals should help grieving parents begin their grieving process and should try their hardest to not complicate the complicated nature of perinatal loss and the grief that comes along with it. As previously, explained, Rando's 6 Rs of the grieving process, it actually may be too early after that initial loss to expect a newly grieving parent to begin the process of readjustment or reinvestment in really anything but a very preliminary or superficial way. But the focus at this time period really should be on the planning for future grief work. And as Higgin points it, newly bereaved people are especially unlikely to be ready to completely reorient their lives. Parents, families, and all parties involved really shouldn't be rushed in this process. Instead, we should create an atmosphere that's conducive to the earlier Rs in Rando's 6 Rs of grief, which are recognition, reaction, recollection, and relinquishment. So these are things that should be created and hopefully maintained for the parents to help them progress to those later stages. In addition, there's a variety of resources that should be available to them, and this includes educational, medical, psychological, as well as aesthetic resources that we'll talk about in a further detail in just a couple of moments. Interestingly enough, it's the aesthetic resources that are most often overlooked. And when you look at these resources, these are things that are actually can be provided at a relatively low cost to the hospital, and the impact that it has on families, it truly is priceless. Studies also show that parents express frustration and even anger with a lot of the rules, practices, policies, procedures of hospitals. Mainly, the thing that was often cited is not allowing parents to spend enough time with their deceased babies. Another challenge is having them rooming in or sharing a care space with healthy pregnant women that are laboring or they're postpartum and they've delivered healthy babies. I do want to note that I think the trajectory of healthcare settings is to move to that private environment. But I think that is something that needs to be absolutely prioritized in this period of grief for parents and families. Um, so having that shared space with a family or parents that are experiencing a completely different path of their pregnancy, it really does undermine their need to connect with their babies. They aren't able to fully recognize and react to the loss, and then they struggle recollecting their baby in the future. Um, Another thing that persistently is expressed by families is there's a fear by these grieving parents that they're going to forget the baby that they had lost. Um, so something as simple as extending the time that parents can spend with their babies, and ensuring that this time is in a private and intimate space can actually help the parents remember and possibly allow other immediate and extended family member and friends to connect with the baby. Parents should be encouraged and afforded as much time as they need with their baby to explore their baby physically and appreciating all of their features that it can help them create memories of their baby's look, feel, and smell. Helping create vivid memories of the future, and again, progressing to those future stages of grief that were described by Rando. If at all feasible, again, grieving mothers should be given a room of their own so they can focus on their baby without the fear of distraction or even judgment, and the ability to feel, sadness, anger, or envy or any other emotion. In the presence of parents that are not going through what they're going through. This allows parents to focus their aesthetic attention and they can connect in a meaningful way, however they determine that meaning with their baby. So we're going to take the remainder of our time here to kind of go through some specific aesthetic resources that I've experienced in my own practice. And I hope that other parents, families, and health care professionals have experienced in their practice. So just highlighting again, we're going to walk through the 6 phases of Rando's phases of complicated grief. Again, recognizing, react, recollect, relinquish, readjust, and reinvest. And just give some specific examples of what healthcare professionals can do in the setting of perinatal loss to pull in aesthetics and help families progress through these stages to live a meaningful life after loss. So the first stage is recognition. So acknowledging and understanding their loss. You want to help parents and families to acknowledge the reality of their loss and also the death. This can include things encouraging the family to name the baby and in future acknowledgments through conversation, in written words, and introductions, use that infant's given name rather than just identifying them as a baby, child, or infant. As previously stated, we really want to encourage that physical touch through whatever is valuable to that family, whether it is holding and dressing or something more intimate as bathing and styling the infant's hair. Engaging in that full sensory experience is going to help that vivid memory formation. Again, that's going to help them progress through these stages of complicated grief. Again, engaging in that full sensory experience, helping the family to identify, acknowledge, any physical features, especially features that tie them directly to the family, whether it's an eye color, hair color, shape of their nose, or something as simple as how adorable, 10 fingers and 10 toes can be. Really creates a vivid memory and makes them feel like a family in the setting of loss. Um, Every family wants to know the height, weight, length, and you could take it a step further and give them the infant's head circumference. All those measurements can then be translated to visual memory aids that can be integrated into memory boxes, scrapbooks, and things like that. You want to facilitate opportunities for the families to create whatever type of memento is important for them. Again, whether it's, footprints, that lock of hair, or the infant's first haircut, attaining a birth certificate or whatever certificate is available in the setting of their loss. So really ensuring that these families aren't only going home with a death certificate. We want to celebrate the pregnancy and the birth and not only the loss of this infant. This may be a birth certificate, this may be a certificate of a stillbirth or certificate of a birth resulting in a stillbirth, and not just a death certificate. Interestingly enough, many states do issue these certificates, but some states such as New York, Vermont, Washington, Oregon, New Mexico, Michigan, and Hawaii actually still don't. So this highlights an area of your future research and advocacy in the setting of aesthetics and perinatal loss. We also want to facilitate opportunities for all family members to meet the infants. This includes siblings, aunts, uncles, extended family. The important part of this is to make sure that this interaction is not forced, but in the situation where it is desired for those individuals, we want to support those interactions. Moving on to that second stage, reaction. So you want to support the family's expression of emotions, whether they are negative and positive. Also recognizing that their initial expression may change over time. We've already talked about this a little bit, but creating a private space for family to feel those emotions, whatever they may be, but also remaining emotionally and sometimes physically available if the family needs support through that time. You want to actively listen without offering advice during this time period. It's important to, create that barrier regardless of your personal or professional experience, really acknowledging that everyone's experience of grief is extremely unique and personal, and you don't want to project your feelings or experience onto this time in their life. We really want to encourage open dialogue about the pregnancy, the positives, and unfortunately the grief that is coming along with their loss, but encourage them, they still went through a pregnancy and a delivery. So encourage them to talk about their journey, sharing stories about feeling the baby move. That first ultrasound, maybe where they found out they were pregnant or the gender of their infant. Gender reveal party. We can't go through a presentation about pregnancy without talking about gender reveal parties. But talking about those events, maybe the theme of their nursery is another aesthetic experience that we should highlight. Playing some meaningful music, and then facilitating any spiritual or religious rituals that may be important to the family. That third stage of complicated grief is to recollect. So creating and preserving memories that these families can cherish in the really difficult days ahead. This can be in the form of photography. We do ink, like hand and footprints. Again, that baby's first haircut, collecting that lock of hair and creating a memento. We do silicone hand and foot molds. Reading the infant a story, and that book can then become a memento for the family. We want to save all materialistic items. This includes hospital identification bands, blankets, hats, clothing, crib cards, anything that is of value to that family. Again, this is obtaining and documenting all those important newborn measurements, and then putting all these items into some sort of a memory box, scrapbook, or artwork to help them create and preserve these memories into the future. This fourth stage of relinquish is going to help the families, parents and families say goodbye, while also maintaining that continuing bond. Again, facilitating those religious and cultural rituals, encouraging, active involvement with the baby with, dressing, swaddling, bathing, encouraging the families to place meaningful objects with the infant, whatever's important to them. Again, this could be a blanket, a teddy bear, or an important religious or cultural item. Encouraging the final holding, but also making sure that it's clearly stated that they comprehend that this is final. It's, leading up to that point of saying goodbye and allowing them as much time that they need in this moment. I mentioned photography previously. There's a bunch of incredible organizations out there that offer professional photography services free of service 24 hours a day. One I know of particularly is Now I Lay Me Down to Sleep, where they will come any hour, any of the day to give, professional quality photographs to these families, even in the time of loss. Creating opportunities for siblings and extended family to say goodbye. Providing uninterrupted time and privacy during this time and leading up to separation. We often will signify that there's been some sort of a loss. So family members and healthcare professionals, don't barge into a room and do that, obligatory, the baby's beautiful, congratulations, when it wouldn't be warranted in this setting. This is often signified with a picture of like a leaf with a teardrop, which I think is powerful because it shows the dynamic nature of grief. The leaf is signifies life and hope, and that droplet of water that's on there signifies the tear that often accompanies moving through those stages of grief. Stage 5 is to readjust, so supporting families as they adjust to life after this perinatal loss. Having a discussion about what to expect emotionally in the hours, days, and weeks ahead, especially triggering events such as due dates, birth dates, holidays, things like that. Having a conversation about postpartum expectations. The reality is they still went through a really physically demanding time, and losing an infant doesn't stop the cascade of hormones after pregnancy. So helping them cope with the physical changes that their body is going to go through, and things like lactation, discussing how they can possibly donate their breast milk, things like that to help other families in need. Also having conversations about future pregnancy expectations and family planning, especially if this loss is in the setting of something that could be passed to future children and future generations. Connecting the family with support groups, bereavement resources, grief counseling, as well as identifying local support systems through their family and friends. And then there's also routine follow-up by the healthcare professionals, and this can be done through phone calls, postcards, greeting cards, things like that. And then lastly is reinvestment. So again, integrating that life into or their loss into their life moving forward. This is a later stage, which can take every, families quite a bit of time to get to, but encouraging or connecting them with resources to participate in memorial events, creating some type of memorial space, supporting charitable events that might be tied to the specifics of their loss, creating annual remembrance traditions, like I mentioned, support groups, and then really facilitate the exploration of future goals for that family, again, especially around future childbearing and family growth. All right. All right, these are our resources. All right. I would want to thank you all for your time joining us and listening to our insights on this topic. There's our contact information if anyone wants to reach out following today's presentation. And I'm not sure how much time we have left, but we'd like to open up the floor for any questions or comments.
Thank you so much, Lauren and Sheila. Okay. So, so we now have time for some questions. So for anyone who has a question, you can either put it in the chat area or you can raise your hand. Marianne and I will be looking through to see who has hands raised. Um, I don't see any hands raised right now. but I can ask a question. Um, so I had a few questions, but I'll just ask one to get the ball rolling. So the first one is for Lauren. So these services that you're talking about, they sound really wonderful. I've had several friends who have had losses, one in particular that was a very traumatic loss. I had a miscarriage myself, but I kind of had my own, because I study rites of passage. So I knew that I needed to have a type of rite of passage around that miscarriage. It was not in a hospital setting, so I did it at home. I'm wondering, since you're inside the hospitals, what do you think? Are these services like generally used across the hospital system in the United States, or is this something that's really lagging and that families are not provided with this?
Yeah, thank you so much for your question. I think this is an excellent topic. I'm really fortunate that my nursing career grew, at a large academic inner city pediatric hospital, where admittedly I think the resources are probably a little more abundant than in some more remote community settings, and certainly in the setting of a home birth, which is quite popular these days. But I can talk about the time in my career. So I became a nurse in 2009, and our very specific delivery unit has grown exponentially. Not only in the services we provide, the amount of patients we can accommodate, but I think specifically around bereavement services. So I think where I work, these services are quite abundant and definitely utilized to their fullest extent. But I do think there's probably utility in expanding these services to, places that don't have, the same access to resources, and certainly individuals that choose to deliver at home. But I will say that the programs that we use and staff are available 24/7. We even, we train a subset of our pediatric nurses and neonatal nurses to kind of step in the place where former professionals aren't available. Something that we also do is we make sure that all cultural and spiritual, ethnic, racial, you name it, are well represented, and whichever individual is providing these services, it it they aren't unique to their, for example, if it's a Catholic priest that is on call, they are able to attend to any loss that occurs in that time period. But yeah, I do think I think there's wonderful services within these larger academic institutions, but specifically some of the organizations we referenced in our lecture, and then the company that does professional photography. Those services are not limited to inpatient hospital settings. So I think a little bit it becomes to education and awareness of what's available, and then connecting individuals with the resources that are available.
I see. And so do you think that it's mainly the chaplains in the hospital that are doing the work of the bereavement, or is the nursing staff also involved?
It's quite a dynamic and multidisciplinary team. It involves, chaplains, again, of all cultural and religious denominations. And part of our orientation and onboarding in the neonatal ICU, and I believe as well as the other intensive care units, includes a piece of bereavement. And then most units have like a local bereavement committee as well, to ensure for staff that aren't as well versed or prepared, or truthfully may not be able to emotionally or physically handle a perinatal loss. Again, talking about that secondary victim, this is absolutely 100% about the family that is experiencing the loss. But in pediatrics specifically, we often talk about family-centered care. So you have the second victim, is often that extended family, and then the third victim extends to the healthcare professionals that are involved in those situations. So not only do we have abundant resources that start with nursing and move all the way up to our chaplain services, and those local committees, but we also have quite a robust like care for a colleague program that supports those, that third victim of loss, because it can be quite daunting to experience that at any frequency in your career.
Thank you.
Yeah, thank you for your question.
Any other questions? Sheila?
I actually have a question for Lauren.
Okay.
So we've been working on this and we have plans to expand it. So I'm wondering about what you were just talking about. I'm wondering if you think participating in this kind of bereavement care and the sort of aesthetic resources that we talked about is also beneficial for the caregivers, the care workers, the medical professionals. So if you could speak to that a little bit, that could be interesting.
Yeah, absolutely. It's as we were working through, this project too. I think the immediate emotional reaction when you're talking about any loss, perinatal or anything, it's I think the expectation or the societal expectation is that it's negative. But I think something that's incredible that speaks to again where I've been really fortunate to start my career is some of the most challenging situations I've been in regards to perinatal loss, actually have been some of the most fulfilling of my career. And that is because of our robust support of bereavement services that are provided. Um, Especially, I think in the unexpected perinatal loss is challenging for anyone to process, but I think in the setting of when those losses may be expected for whatever diagnosis the patients have. Um, the services and processes that we have in place often end up giving families and staff more time with these critically ill infants than they had ever anticipated. So although the loss is expected and imminent in most situations, I think what I think of most is again looking at that unique individual and catering the experience to them. And I think in the trajectory of my career, which is some of it is professional growth as well, and situations don't change, but your reaction and maturity towards them change as well. But I think what I probably often associated with distress and sadness really became quite a positive experience towards the end of my nursing career. But I don't think you can talk about any loss without talking about all of the victims involved, with the priority being the parents and the immediate family. But in all of pediatrics, especially neonatal, and you know, pregnancy, you have to talk about the extended family, and the multitude of multidisciplinary caregivers that participate in this process as well.
Thank you.
Mhm.
Are either of you aware of artists who are creating art for families, like pictures of parents with their lost baby or anything like that? I have found some online, but I was wondering if you found anybody.
I actually have found some, and also I won't be able to pull it up real quick. There are some internet resources where people contribute their own work and their own creative projects that they made to honor their lost babies in a huge range of ways. I will find it and send it to you. I'm not remembering the details, but there's one in particular that I was sort of blown away by, and I can share that with you.
Yeah, I ask in part because we have a lot of artists who are going to be part of this symposium. So, and many of them are doing beautiful pictures of birth, pregnancy, and this is another piece that
Yeah.
I know some artists who have done an array of topics, but they're also starting to work on bereavement portraits of families. Anyone else have a question?
I had we have a question from Magdalena.
Oh,
Let me unmute you. There we go.
Yeah,
go ahead, Meg.
yeah, thank you. Sorry, I may have missed the beginning and I joined later. So I am just wondering about loss for people who are single parents. Is that something you have encountered in your work? Sorry if you covered it already.
No, that's an interesting concept. I will say in my time working as a neonatal nurse and attending deliveries, I can confidently say I think I've seen every version of family, and it's incredible and beautiful to witness. Um, until your question right now, though, I think dealing with one can often wonder, how does an individual progress through those stages of complicated grief alone. I would always hope that nobody's truly alone in a process like this, but that's certainly another layer of complexity to perinatal um, loss that I think even probably throughout the presentation, it's an assumption that it's done at some version of a couple, whatever, a partner or couple looks like to that individual, but definitely an area of further explanation. And highlights a need for that special population as well.
Thank you.
Mhm.
Marianne, did you have a question?
Yes, I just had, you both mentioned complicated grief, and I guess that's not a term I was familiar with. What is uncomplicated grief, I guess, and what's the difference that's made there when you're talking about grief?
Right.
Mhm.
So Rando is talking about there are different terms for it too. I think I forget the DSM has prolonged grief. There's a few different ways it's named. But it's or sometimes it's called pathological grief, right? But it would be grief that, I think all grief is complicated, so maybe the word isn't the best choice. But the idea is that there's, someone is sort of really stuck significantly. Of course, grief is going to take different periods of time and so on. But I think one of the symptoms is 5 to 10 years of, you know, inability to sort of integrate the loss in any way that allows the person to sort of live fully in their present lives. So it's extended grief. And of course, when we talk about grief, as we talked about Robert Solomon and the idea that this is a continued relationship. Sometimes people talk about grief as like or death as the end of the relationship, but the idea is like adjusting to the new way of relating to this relationship and new way of understanding yourself. So yeah, there's different terms. I like Rando's, we liked her 6 stages and how in a way they were uh, more sort of instructive than descriptive. Kubler-Ross's doesn't really help you in your grieving. It just kind of describes it and lets you feel like you're normal when you're struggling. But so yeah, she calls it complicated, and she also calls it mourning, which is not the same as grief. Mourning is the expression of the loss, and grief is something else. The process of it. So you can grieve without having that expression externally. So I don't know, does that help?
Yeah,
There's different ways of naming it, and there's more sort of diagnostic and medicalized, the DSM kind of thing with its symptoms, and I think they call it prolonged grief.
yeah,
And of
that's
course, all
true.
grief is prolonged, all grief is complicated. So I think it's going to be a matter of degree and just how well the person is, whether they can flourish in their present and future.
Yeah, that's very helpful. Thank you. I think maybe Barbara, you had your hand up, but I wasn't sure. All right.
I had a question about the 6 phases that you discussed. So I guess this is for Sheila. So these are often described as like kind of bringing some closure to your memory of a person that was in your life. So when you're dealing with a loss of, either a newborn or a stillbirth or a fetus, you don't have these. I think that when Lauren was talking about celebrating the pregnancy and the early phases of the pregnancy or throughout the pregnancy, that kind of
Hmm.
is like your memory of this experience. Um, I'm wondering if the fact that you were dealing a bit with a potentiality when that you lost. There is a real thing too, but it's also you're dealing with like something that's potential. And so it
Hmm.
seems like that puts you in a bit of a liminal space of loss that is unlike a loss of somebody you've known for a long time. So for example, your father.
Right.
Could you speak a little bit about that, those differences, and how, in a way, I feel like the potential loss is it seems like it could be more painful because with the actual person, you had this like real experience,
Hmm.
these strong memories that you can connect to, whereas the potential, you're imagining what this person could have been.
Yeah, I think that's really important. And I think it's part of the challenge of this kind of loss and the grief and the sort of public recognition of the loss. So I think one one aspect of grief that helps me understand this is how forward looking grief is or grief is based, because it can't be just based in your memory, right? Because that's the past. You have already had that with that time with that person. But in any relationship, you're anticipating a future. And I think with a child, you're really anticipating that future. So there's, the life or the family that you wished you would have, that you wanted to have, but also thinking about who you are, right? If you want to be a mother and you were a mother and you thought, as a mother, I'm going to do this, that, and the other thing, and this baby is going to be loved in these ways, and I'm going to teach them these things and that I love, and that's taken from you. I think that's a large portion of the grief. And I mean, I'd have to think more about this, but I think the pain of grief is a lot of it, if not most of it, is future looking. It's a loss of a future because you have already had the time that you've had with the person. Um, so the mourning, or the grief is really about what you didn't get to have with that person. So I think the ambiguity here is why, people who have these kind of losses, these perinatal losses, are not, acknowledged. I mean, miscarriage, I'm so sorry for your loss. And I think it's just a shame how society does not acknowledge that. We don't acknowledge that publicly at all. People don't know what to say. And often we'll jump into, well, you could have another baby, as if this wasn't a real relationship and a real person with real hopes and dreams associated with them. So I think the pain of this kind of ambiguous loss complicates the grief because people don't, they're like, well, and I remember I can say when I was young, my sister, Lauren's mom, had a miscarriage. And I was very, probably like 15, I think I was 13 when her first sibling was born. And I remember thinking, there's nothing lost, right? Like I didn't understand it. And I've since talked to her and said, like, I wish I was more mature and understanding, but I wasn't at that time. I did not understand the loss at all. And I think many adults just haven't thought about it enough to realize that how deep that loss really is, because of the future that has been, taken from you. So I don't know if that's helpful, in thinking about the nature of these losses.
Yeah, I think it is. And I think it's also that, our culture doesn't talk about miscarriage enough. It's
Yeah,
starting to
a little
maybe we're
better.
starting that conversation, but it's, similar to you before when I was younger, I just thought, oh, miscarriage, it's like, it's not a big deal, and then, I've spoken to many women for whom that was a major point in their lives when they had a miscarriage.
Right.
And also, I think that sometimes people I know who have had losses, I refer to them as mothers of. So, for example, one of my best friends, she lost her first and then she had another child. So I always say she's a mother of two.
Right.
And she has told me she really appreciates that because that first child who she lost right at birth is still a part of her and her
Right.
memory.
Right. And I mean, physiologically, the baby's a part of her, right? I've
That's
read
right.
recently. Yeah,
Yes,
it's really,
that's right.
it's kind of terrifying, but because I have two kids and
Yes.
that kind of freaks me out. But
Yeah.
but the other thing Laura and I talked about yesterday very briefly is I also think there's a lot more work to be done around abortion and the loss involved there. And I think it's politically so charged that we never talk about that
Yeah.
that
Hmm.
something significant is happening here and there's no way for those women to mark that and maybe they wouldn't all want to but some probably would like some bereavement
Yes.
help, right?
Right. Right.
There's also there's also a lot of ambiguity in that future, like the loss of those potential memories too, with the advances of just medicine and science. I think historically there was many medical diagnoses where it was expected or known this child may not make it through pregnancy and or delivery. So some families were able to kind of build that barrier or that wall very early on, and they didn't allow themselves to make those future memories, and maybe or maybe not that helped them in the grief process. Um, However, with the advances of medical technology, there are infants that historically wouldn't have survived pregnancy or made it through the delivery room, but their length of their life is still often understood. And it can be moments, days, or years. And it's creating what's an already complicated, ambiguous situation. It's blurring those lines even further, which I think is another layer of complexity in the grief process. In the past, I didn't allow myself to make memories because they weren't possible for this infant or this diagnosis. But there's these case studies or this population or these medical advances where kids are surviving longer than they ever did before. But people are still unsure what their life or that child's life may look like. And I can't imagine how challenging it would be to move through any stage of grief with almost everything about that process being completely unknown and ambiguous. So medical, technology and science and medicine is fascinating. And obviously I've made like a career out of it. But it certainly does push some boundaries and definitely complicate the perinatal grief process as well.
Yeah, another thing I'll mention is in doing the research, I found a couple of studies about the challenges that fathers feel and not being supported in the bereavement in the grief process. Many of the mothers feel unsupported, but often the fathers they have different challenges and much less recognition for their loss.
Yeah, that's important. Definitely. Okay, well, if there's no other questions, then I think that we'll close off our co-keynote discussion and we'll take a break. Our next session is going to be in, let's see, 9:45. So Lauren and Sheila, that was wonderful. Thank you so
Thank you so
much for
much.
serving as
Thank
our
you.
keynote speakers. And you have the links if you want to come to any of our other talks. I know
Absolutely.
I know you're probably both pretty busy, but
I
but
have them in I several in my calendar. I will be stopping in for sure. And I'll send you the slides in case anyone wants to look at the sources.
okay, that sounds wonderful. Yeah, thank you so much. I would like to look at those. So
Thank you.
all right, so for everybody who's here, we are going to start our first session at 9:45, so in about 15 minutes, and that is going to be aesthetics and artistic practice. So we'll be talking quite a bit about art, and I will be moderating that. So for now, you can take a break, get a cup of coffee, and come back in about 15 minutes. And I'm sure other people will be popping in too. So thank you so much.
Thank you all.
Thank you.
Okay, hello everybody. All right, we are going to start session one, which I'm very excited about. So this session is titled Aesthetics and Artistic Practice. And we are going to begin with Alexandra Carter. So Alexandra is a San Diego-based artist whose work explores themes of fertility, maternity, and transformation, often drawing on her upbringing on a cranberry farm in Massachusetts. She holds an MFA from Goldsmiths University of London and a BA from Rhodes College. Her work has been shown in solo exhibitions around the world. And her paper title today is The Body as Floodplain, a Visual Poetics of Pregnancy and Birth. All right, so I am going to spotlight you. Wonderful. Okay, so take it away, and we're very excited about this. Go ahead, Alexandra.
All right. Thank you so much, Anna, and I'm so glad to be here. So yeah, I titled my talk "The Body as Floodplain: A Visual Poetics of Pregnancy and Birth" to give you an idea of the themes in my work and to hint at this important aspect of my background. So in the talk, I'll start by talking about that background a little bit, about my materials. Then I'll go through some of my work piece by piece, talking about those overarching themes, starting with fertility and conception, and then birth and postpartum. So this is where I grew up, on a cranberry farm in Southeast Massachusetts. Cranberries are indigenous to North America, in case you didn't know. And this exact area is where the very first cranberries were discovered and replanted. So cranberries, they weave their way in and out of my work. They're not always present, but there's something I come back to very frequently in my subject matter. So here I am as a teenager in the berry pool with my uncle and my grandfather. So the title of my talk, The Body as Floodplain, really refers back to this process of flooding that takes place in cranberry cultivation. Bogs are flooded and berries float to the surface. So in my work, I liken that to the female body. Especially when I was embarking on my fertility journey in the beginning, I was really struck by how the language being used for my own body was the same agricultural language I grew up with. So words like fertilization, growth cycles, harvest, etc., especially in the IVF world, which is what I ended up pursuing. My materials, again, kind of refer back to the body as floodplain. They are, for the most part, acrylic ink, and which are similar to watercolor in terms of how they look, but they're a lot more saturated. They're much more permanent and durable. I use lots of water. I puddle it around. I push it around, as you can see in this in progress shot here. And I think that this materiality really relates to the explosivity and the leakiness of the body, particularly the female body, which is something I've long been interested in, is that explosive quality. The surface that I work on is translucent drafting film, which is like a non-porous frosted film. And so I use the translucency to my advantage, and often I install work like this, so making them kind of these double-sided paintings that are much more engaging and confrontational. So I think that really doubles down on this idea of explosivity and perhaps the idea of the sublime that we're talking about in relation to birth and pregnancy. Here's another installation example. These are fertility figures inspired by ancient figurines that I've co-opted with my own language, kind of layering cranberries into the body. And so again, speaking to that agricultural and bodily fertility. Here's a more recent one as an example. This one's based on that figure on the right. That's a Sumerian goddess, Inanna, also known as Ishtar. This one I consider in the realm of the fertility figure, but it also heavily references the mother and child imagery in art history, like Byzantine painting, and also ancient symbolic traditions. The title here, The Inundation, refers to both the annual flooding of the Nile, that's the technical term for it, but also to the flooding of cranberry bogs during harvest for me. So again, back to that floodplain idea. And also incorporating these ancient cycles of water, abundance, and ritual into the ideas in my work. This one I painted while I was pregnant with my first pregnancy. So I'm equating those big bulbous berries into the body as I was before, but this time it's not just a spin on Paleolithic fertility figures. It really spoke to how I was actually feeling at that time. That idea of weight, the sensation of that, and the sensation of having another being moving inside of you. This one came out over many months of slowly building up these layers, these many orbs that the figures are buried within. The berries remind me of cells of an embryo multiplying, again, coming back to fertility and especially to the IVF process. Both of my kids were conceived through IVF, so that's been a big point of interest in my journey, as well as the source of research for my work. The next group of work gets into more pregnancy and into this idea that I call the acrobatics of motherhood, the way that we twist and turn and contort our bodies to conceive, to birth, and to care for our children and to do it all as mothers. So I'm using that as this heavy metaphor, basically. So with this one, the title, edema, which is a common symptom in pregnancy, which is water retention or swelling of the body. It might not actually look like this, but it definitely feels this way. So again, I'm coming back to like the visceral sensations that we have inside of our bodies through these stages. This one is not only talking about the acrobatics of motherhood with this movement of the body, but it also feels very liquefied, like this blob-like nature of the body. And that's something I'll get into some more. It speaks to the body becoming both engorged and unrecognizable, the sensation of feeling like a blimp. I titled it Stims after the stage in IVF where you are stimulating your ovaries to hyperovulate. And this piece is actually speaking to me so much right now because I'm actually in the middle of another round of IVF to try to get another child. And so I'm currently on day like 14 or 15 of stims. So I'm feeling very blimpy in my ovaries as we speak. So I had to include that piece in this talk. So in this one, the main figure is twisted and distorted, speaking to that acrobatics again. But the orb above her is it's actually taken from a chart that indicates the stages of uterine growth during pregnancy. So it's again marking these passages of time that's as yet another set of goals to attain. And here that piece is installed in a solo show that I titled Monstrous Mothers. So speaking of monstrous, this one definitely gets into the monstrous feminine, which is another aspect of my work that I want to touch on. So this piece is the first painting I did after my first birth, and I was really struggling with breastfeeding. The title is a play on colostrum, as if I was going to turn that word into a woman's name or a monster's name, colostra. But meanwhile, I was really starting to be drawn to imagery of monsters ever since that birth. And like this, like I was trying to unpack why that was. So I think what was going on is now that I was a mother, I was really reflecting on the rapid transformations that my body had just been through. That grueling process of infertility treatment, then pregnancy and birth. It ignited in me this sense of the monstrous. And I don't mean that in a negative way, but more in like this extremely powerful, ferocious, primal way that I was just really struck by. The mother as protector and aggressor. This piece in particular, it actually was used on the cover of this recent book, Gone Feral: Unruly Women and the Undoing of Normative Femininity. But in this piece, I referenced old imagery of monsters like gargoyles and other fantastical creatures. Then I combined it with my cranberry symbology tucked in there and embedded it all in this heraldic structure like a family crest. So really underlining a sense of family or motherhood here, this shield for the protector. With this one, the mother figure rises from this swamp-like space. She's both tender and feral. I'm really interested here in monstrosity as a maternal force, this monstrous feminine as a bodily power bound to creation and wildness. Here are some details of that piece. Yeah, so I'm thinking of the monstrous as this instinctual bodily knowing that carries us below reason, beneath language, closer to something ancient and wild. So again, getting back to this idea of the sublime. So with the next few pieces, I'm getting into more literal depictions of birth. This one for sure. This one reflects on my most recent birth 2 years ago. And in that birth, I experienced these powerful sensations called the fetal ejection reflex. I didn't have to consciously push at all. The baby kind of shot out of me. We had actually planned, this birth was planned to be a hospital birth. But there I was on the bathroom floor, and I thought I had plenty of time left. And then I started feeling those powerful sensations of the fetal ejection reflex, and there wasn't time to get there. So I ended up having this beautiful surprise home birth. But here I see the bird as this representation of that awesome power that was going on inside of my body. Here's some details of that piece. And what I think is interesting about this piece, though, is I think viewers can see it in different ways. The bird's beak kind of looks like forceps. So you could almost see this as a more interventionist birth, like there's mechanical extraction of the baby going on. And I like that. I like that there's like room for very different experiences in this imagery. With this one, I'm thinking of the birthing body as both portal and creature. I'm thinking a lot about that moment of emergence and surrender when the body seems to open to another world. The title spinneret is the silk producing organ of a spider. And I think of that as this like metaphor for the quiet, instinctive labor of producing new life and caregiving. I like how the cranberry forms in this piece suggest this engorged womb or egg sac. The figure is somewhere between bodily reality and myth, while hinting at a spider. I'm really interested in that crossover into monstrosity. The mother as a being who generates and shelters and really pushes the boundaries of what is human. With this one, I was thinking about water birth. And also just thinking about the moments right after birth when the baby comes out and they're often a really different color from the mother. It's something I find so striking in birth photos. And so here I'm really exaggerating that difference and kind of flipping it. So the next few couple pieces get into this more maybe a more nebulous period. It could be pregnancy, it could be birth or postpartum. All these stages where the boundaries between mother and child is really blurred. I painted this piece while I was pregnant with my second child. And in both stages of trying to conceive or finally pregnant, I always felt like this vessel that needed to mold to the whims of my reproductive system, to the demands of pregnancy, and to the child I already had. I felt this pressure of needing to be receptive to new life, my body needing to be strong yet soft. The title metrium is taken from the name for the lining of the uterus called the endometrium, which is really important, especially in the IVF process. So yeah, I've been making images of blobby bodies like this, which really refer to these intimate physical demands that are so inherent in the life of a mother. There's so much touch and contact that we have with the beings that we grow inside and then outside of ourselves. So with this one, I think of really early postpartum. The baby is out of the body, but the mother is still really organized around that baby, both physically and logistically. It's that threshold where mother and child morph together, where cells, memories, and emotions intermingle. I'm thinking about the traces a child leaves within a mother's body, as in that fascinating term, microchimerism, which describes how a fetus's cells stay in the mother's body long after birth. So I want the work to hold that in-between state where boundaries are not clean. I made this one while I was doing IVF. So I was prepping my uterus for pregnancy, thinking of it as this holy vessel, warm and ready for conception, while at the same time feeling so trapped by the physical barriers of my own body and its limitations and my infertility. But the title, in vitro, so it's obviously the first two words of IVF, but it also translates to in glass or in a test tube, which I think really emphasizes the fragility of both the mother and her entrapment. The face of this figure is modeled from the head of Medusa, the Gorgon, from an ancient Greek frieze. And so that it motions towards the importance of mythology as something I often reference in my work. And so the next several pieces, I'll be talking a lot more about mythology. So this one, again, uses imagery of Medusa the Gorgon, but refers to more protective elements of that face. So, but then it's mixed with the body language of a maternity photo shoot. So this face that's on the belly is taken from the Gorgonean, which is often an amulet or a shield depicting the Gorgon's face. And it was considered to be apotropaic, which means it wards off evil. Athena is often depicted with the Gorgonean on her armor for protection. And so here, the Gorgonean decorates a large pregnant belly, protecting its interior life. And that's just something I think I felt compelled to do in reflection of my own pregnancy after such a struggle with infertility. This one was used on the cover of this book of essays published last month, Mother's Myth and Mythos, Maternal Narrative Knowing. And the piece includes this kind of chaos of imagery, right? But the way it connects to mythology is that I referenced art historical images of parents in mythology. So on the upper left, the figure is Medea. She's a witch and a mother. And to her right is Kronos, father of Zeus, who ate all his children. So there's definitely a dark undertone there. But there's also some burlesque iconography tucked in there, mixed with abstract elements and a rendering of my own child's face. And so the idea of family consumption and gathering came to mind with this piece, hence that loaded title, Family Dinner. So speaking of consumption, now I have just like 3 pieces left that I'm going to talk about. And they are more specifically about postpartum. So this one presents this cycle of sustenance and nourishment for the babies, obviously, through breastfeeding, but also for the mother. As you probably know, breastfeeding requires a ton of calories and hydration. So I love that the mother is getting her hydration here, and from none other than cranberries, of course. At least they are cranberries in my point of view. A lot of people think that they are pomegranates. I think of them as like oversized cranberries. But either way, it's fine. I love that the fruit acts as this life-giving force across generations. With this one, I referenced images of myself with my son in the postpartum period. And I'm definitely thinking about that feeling of gravity that's really so palpable in the postpartum experience, kind of the body falling out of itself. She is part woman, maybe part shell, part tree, or root of some kind. So she's both kind of a little bit monstrous, but also earthy and wild. And this is the last piece I'll talk about. It's my most recent piece. It's actually behind me here in the studio. With this one, I've combined these fragmented figures based on myself and my 2 children with transferred diagrams from a scientific paper titled The Physics of Cranberries, which details the forces acting on cranberries during the harvest process as they fall, they float, they cluster. So again, coming back to this idea of the body as floodplain, I'm interested in those diagrams as metaphors for the invisible pulls between bodies, attraction, dependence, attachment, this kind of strange physics of family. Here's some details from this one. So it allows you to see those diagrams a little bit more specifically. I added these directional droplets that move throughout the composition like signals or vectors. So the composition reads as both bodily mass and force fields. My husband is a physicist, so I like to think of it as all 4 of us have a presence in this painting. But yeah, that's it. And here's my contact info. Thank you so much for listening.
Thank you, Alexandra. That was wonderful. I'm sure we'll have some questions afterwards. Okay, I am delighted to introduce our next speaker. Her name is Linda Love. She is a multimedia artist and artistic researcher. She holds a PhD in artistic research with distinction from the University of Art and Design, Linz, and an MA from the Lucerne School of Art and Design. Her artistic and research-based practice unfolds through international exhibitions, teaching positions, and regular publications. Linda's paper title is Gestation as Performance, the Aesthetics of Everyday Care and the Feminist Sublime.
Gestation as Performance, the Aesthetics of Everyday Care and the Feminist Sublime. So in 2018, I got pregnant. I continued to work as a performance artist, but as soon as my gestation became a noticeable part of my body, everything was charged by the unstoppable, motherhood. And everybody suddenly seemed to know what a pregnant body is still allowed to do and what to leave. I felt like a raw egg that was desperate to be eaten. So the shell had to stay intact. Whether it was something as mundane as sleeping or physical activities like skiing, every move I made was watched, commented on, or even criticized. 2 weeks before my due date, I went to a concert where the bus was really thumping. No one had stopped me from doing that. No one had warned me about that beforehand. I stood on the ground and the vibration climbed through my body. The amniotic sac began thumping along, vibrating along. Will you like music? Will it be the same kind? When will I go to a concert next? And where will you be then? The music climbed inside of me, through you. It felt to me as if you liked it, celebrating along, celebrating that I would finally come to rest. Can you feel how bad I am at that? Staying calm, taking a break, breathing? Will you be just as restless as me? While the crowd cheered all around me, your world suddenly collapsed around you. Your world cracked. Completely in secret, very quietly, it began to drip out into mine, into ours. And the bass thumped and the music raged, and I stood there and didn't feel it. Didn't notice how your world dissolved, drop by drop. Afterwards, we were still hanging around outside. And some man joked, if this boy didn't become a musician now. Why a boy? Anyway, he wouldn't be surprised if it turned out to be a boy after all. You never know, but male and white has second sight. Stay inside that just a little longer, I thought to myself. Out here, the vibe is so patriarchal right now. Just wait, maybe the thunderstorm will clear up again soon. But it was already dripping. By then, it was already too late. One day later, at some point, you were out. Head pressed out of the vulva, screaming into the world, anticipating what was to come. And all at once, everything was different. With birth, the boundaries to a new reality were breached. For you and me. Alfred Schütz speaks of a shock when the boundaries from one reality to a new, different reality are broken through. And that is what it was. Birth was a shock. Until birth, being a mother was merely an idea, a fantasy, an imaginary sub-universe within my everyday life as a performance artist. My growing belly reminded me of it, tying a ribbon into an uncertain future into which I would sometimes submerge. Imagining what it would be like to be a mother, how beautiful it would be to hold the child in my arms, to press them to my breast. The image of the nursing mother, the epitome of purity, the perfect bliss. Mother and child as a single unit. A rudiment of Western Christian culture. Once the pain is finally over, it will be beautiful. Because that's how it was written in the preparations. Fuck the preparations. In preparation for our birth, we put together a playlist. Songs that connect us and spread an emotional, joyful mood. Plagued by contractions that kept speeding up, the only musical thing filling the room was my repetitive groaning and screaming. I was told to take a bath, to relax. No sooner had I sunk into the tub than I clutched the edge of the bathtub. Just get me out of here. In that moment, I realized that the delivery room as a reacher site, as a liminal space, has failed me. Nothing about these premises had anything sacred about it. The furnishings appeared far too functional, pure in the sense of sterile, not in the sense of innocence. Often, ritual help to cope with the transition into a new existence. They open up a liminal space, a space outside of everyday routines, in which the new phase of life is welcomed and initiated through dances, words, repetitive gestures, and chants. Two years after the birth, I still did not seem to have truly arrived. Not only did my life circumstances change, with the birth, I was also washed over by a wave of heteronormativity, idealization, and paternalism in which I threatened to drown. When I was invited to a feminist festival in the summer of 2021, I decided to confront this first year of parenthood, this birth shock, with a performance to help myself arrive in a new reality. The performance replaced the ritual for which there was no time during the birth. Like a shaman, it accompanied me on the path from the old reality to the new. It helped me let go. It opened up this intermediate space, not only to mediate between worlds, but also to bring seemingly meaningless everyday actions into the focus of contemplation. This performance collectivized my experience. My physical presence and the authenticity of the story created an autopoetic feedback loop that blurred the line between spectators and participants. It was no longer just me who was pregnant. We were pregnant, gave birth to the child, nursed the child with aging breasts, and felt the turmoil between mother, woman, and artist. Becoming a mother, I was made into a woman again. As a mother and an artist, I faced the threat of being excluded from the art world, because both roads stem from the same myth: total self-sacrifice. As I live day to day, relentlessly bound to the child, some are only half happy because I was full-time mother and a zero-time artist, I began searching for cracks in the system. I decided to radically rewrite the socially predefined script of mother and artist for myself and look for a new script, for a way to actively work through these tensions. I developed the figuration of the M-other. I conceptualize her as a liminal being. According to Victor Turner, liminal beings are neither here nor there. They are betwixt and between the positions assigned and arrayed by law, custom, convention, and ceremonial. I began dissolving boundaries between dependence and independence, theory and self-experience, mother, woman, and artist. My everyday life became a performance, and performing became the everyday. I felt at home precisely in those spaces that Michael de Certeau describes as interstices. These are spaces of potentiality. According to de Certeau, these gray zones of daily life can be intervened in through tactical actions. A tactic is not an abstract detached plan. It acts directly upon the body. It infiltrates an existing system, temporarily reshapes it, and makes its internal weakness and contradictions visible. By executing everyday actions no longer automatically, but as reflected acts, the maternal everyday is transformed into a subversive field of political action, a troubling zone. According to Haraway, staying with the trouble requires a fundamental restlessness in order to truly be present. This state demands that we make kin in an unruly way. This kin-making describes a process of thriving together that extends far beyond mere blood relations and species boundaries. It is a conscious breaking through of those categorizations that erect dividing walls between genders, between art and everyday life, between spaces, times, and matters. As me and our child looked back on the first years of parenthood, we became aware of the intense, initially primary physical bond. As a cluster-feeding baby, I often breastfed for hours on end or carried our child in front of our body. At night, the baby lay on my belly. We lived in complete interconnectedness, our bodies always in contact with one another. I was reminded of the one-year performance rope piece by performance artists teaching Sheila and Linda Montano. For 1 year, they were permanently tied together by a rope. This first year of parenthood felt like a reinterpretation of that very performance with slightly shifted rules. While teaching Sheila and Linda Montano put in writing that they would not touch each other during that year, our child and I were in constant contact. Deeply inspired by this performance, we co-wrote a score 5 years later after the birth. That translated both the first year of deep physical dependency and our ongoing connection into a lifelong performance. This reinterpretation, which will endure beyond death, began exactly 36 years later to the day, with the birth of our child on July 4th, 2019. The artistic translation consists of a score, a costume, and a 2-channel video projection, in which our child and I, the other mother, can be seen playing together. The installation places this lifelong, often invisible connection at the center. In the cinematic execution, I appear as a hybrid other, a cyborg being whose body is connected through tentacle-like tubes to objects used for care, interaction, and soothing. The costume is an allusion to the relentless, often superhuman demands that the neoliberal capitalist system places on modern motherhood. The performance score, co-authored with a child, is not a rigid concept. Rather, it generates a space of potentiality within everyday life, where the intensity of relational work can be repeatedly re-examined and mapped out in further artistic works. A space in which we continually make kin in new ways. To claim the everyday as a space of potentiality, it must itself become both the target and the instrument of critique. The point is to performatively question our surroundings, the immediate world around us. It can be in the microsphere, writing a text and reading it to oneself as reparative practice. It can be a lifelong conceptual performance. I developed the M-Other to transform motherhood into a productive, ambivalent interface between body, art, and society. The other mother stands for a hybrid, queer, non-normative physicality that simultaneously provides care, resists, and tests new forms of artistic expression. She is never alone, for she is always already mother and other at once. The ortho-theoretical practice presented here, the indissoluble intertwining of embodied performativity and theoretical reflection, does not argue from a safe distance. It throws its own exhausted, loving and resistant body directly into the balance of existing conditions, to open up spaces of transformation through both writing and action.
Wow, thank you, Linda. Okay, so I'd next like to introduce you to Magdalena Furmaniuk-Kopel. She is affiliated with the University of the National Education Commission, Krakow. She earned degrees in art and is a PhD candidate in art studies at the History from the Jagiellonian University and in contemporary art from UConn. Her doctoral research focuses on contemporary Polish textile objects examined through the theoretical lens of new materialism. And the title of Magdalena's paper is The Fabric of Labor, Ways of Conceptualizing Pregnancy in Contemporary Polish Soft Sculpture. Okay. Wonderful. So we're now on to our last presentation of this session. I introduce to you Dr. Irini Athanassakis, who lives and works in France, Austria, and Greece. Trained in sculpture, transmedia arts, art history, and philosophy, for which she holds her doctorate, her work has been shown and published internationally. She is currently working on Core, Infertilité, questioning dimensions of fertility, infertility, and reproduction technologies as a fellow at Arts and Knowledges at the University of Salzburg and at the IPU, International Psychoanalytic University in Berlin. Irini's paper title today is POIESIS, Making a Baby or Not.
Yes. Good afternoon. Hello, everybody, or good morning.
Hello.
I'll try to share my screen.
in the world.
Um,
In the life of people,
yes, I hear it.
once was considered poiesis per se. Many myths, legends, and fairy tales are implicitly or explicitly about reproduction and sexual life. The increasing infertility of the human species and the extinction of ever more species of fauna and flora can be observed. At the same time, nature and culture are intertwined in new formations through the continuous progress of reproduction technologies and modifications of genetic material. This simultaneity of pervasive infertility and artificial witness is a paradigm shift to an infertile turn and a reproduction technology poiesis. During personal experience with infertility, reproductive
The sound got cut.
poiesis. During personal experience with infertility, reproductive technologies in motherhood, various artistic and artistic research works have been created over a period of 15 years. Drawings, photographs, texts, and objects made of wool, threads, clay, and silver are rearranged here by Notre. Things are not simple. Great Goddess. Alice Neal, Pregnant Maria, 1964. Grobstein, Fishing for Eggs, 1981. Steptoe, Harvesting Eggs, COG, 1977. Cleve, Egg Hunting, 1971. The Mother Machine. There is no inner recess of me left unexplored, unprobed, unmolested. It occurs to me when I have sex that what used to be beautiful and private is now degraded in terrible public. I bring my child to the doctor like a child bringing home a report card. Tell me, did I do well? Did I ovulate? Did I have sex all the right times as you instructed me? Vending, 1980. Oh. Kunst und Wissenschaft als Poiesis? Erzeugung des Homunculus in Goethes Faust II. Habiter, ton épouse et toi, le jardin. Manger des fruits sans contrainte, de partout où vous voudrez. Mais cet arbre, approchez sans que vous seriez tous deux des uniques entre tous. We are water-based creatures, made of flesh and blood. Assisted reproduction increasingly reflects a lifestyle choice that is immediately social, cultural, personal, and political. While on my stems, for the first time, ICSI made fatherhood possible for men with sperm defects. Fertilization is achieved by the injection of a single sperm cell into the cytoplasm of an oocyte. ICSI was developed at the VUB in Brussels in the early 1990s. Longtemps considérée comme une malédiction, l'infertilité reste encore de nos jours une question assez mystérieuse. Les progrès de la connaissance scientifique en ont fait une pathologie médicale et les biotechnologies qui dérivent de ces progrès permettent de guérir un certain nombre de cas. Beaucoup de situations, cependant, restent incompréhensibles pour les praticiens et irrésolues pour les patients. Le diagnostic d'infertilité est admis lorsqu'une fécondation ne fait suite à 2 années de relations conjugales régulières et infructueuses. Les enfants du désir, incompréhensible. Species. Angels. Julia Christopher. Live theory. They do not look like monsters. Estrogen. I wish I had a baby. Sex signaling. Go. I'm Manipure. Clomid. Decadron. Redness syndrome. Fiber taps. Black nail. Polystim. Antagon. Omnitrope. Eva. Injections. I can say that they're not that bad. Mother, nature, mother, culture. Und Tabu. Fast überall. Kreatur. Fleisch. Licht. Venus. Von Willendorf. Wer ist hier die Mutter? Belle douce. Der Embryonentransfer. Nothing is impossible. Aber beim Kinderwunsch sei es eben so. Du setzt dir eine Grenze und dann, tja, gehst du drüber. Combien avez-vous en beauté? Ecto. Je rêve un enfant. Freedom with Firestone, The Dialectics of Sex, The Case for Feminist Revolution, 1970, page 175. Who owns donated female gametes, eggs? Give me children, or else I die. There is more than one meaning to it. Margaret Atwood. Die Unfrucht, the unfruit, is the usual story. The usual stories. Go to Adam, go to noon. Be fruitful and multiply and replenish the earth. What is going on? It's a girl.
That's it.
Thank you so much, Irini. All right, so we had this wonderful group, such an interesting collection. You know, each paper was interesting in itself, but I think as a group, it was also very interesting. So let's open up the floor to questions. Does anybody have anything that they'd like to ask or a comment to start? I have questions, but let's see if anyone else does. Okay, well, I'll ask a question. So, I have questions for everybody, but I think I'm going to start with Linda. So, Linda, I'm very interested in rites of passage of pregnancy and birth. And so I look at different rituals that people go through during their pregnancies and their births. And one thing that I've started looking at in the past 5 years or so are things that happen sometimes much later after the birth has happened that are still part of the rite of passage. So, for example, I think birth stories are very important, and that when that there should be a place for people to give their, to tell their birth story, and that brings some kind of connection for the mother, I think, to her new identity as a mother in the world. And I see in your artwork, it seems to me like you've had kind of, this is just my interpretation, but that your art is sort of like a prolonged part of your rite of passage as a mother. Do you have any thoughts about that? Do you see your artwork, your performance art as kind of a ritual in a way that's connected to the actual pregnancy and births themselves?
Yeah, I mean, definitely. It is, as I was also telling that actually much later, I realized that I was missing this ritual during giving birth. So, and I actually started with writing a text. So this whole performance I was talking about is actually based on a poem I wrote. And that's what I also said in the conclusion, that, I mean, for me now it's maybe a bit easier as I am an artist. So I can set up my own events, so to say, to create a ritual for myself. But I guess this could also work for others, just, to have this moment of writing about what happened. And even I think only reading it loud to oneself is already some sort of read of passage, but it could also be that you read it out for somebody else. And I think it's a great idea to think of some platform where you could, like place all these maybe texts you have, or to have like this opportunity also for people who are not artists to somehow publish these texts or make them visible. And I think if one looks at the history of performance art, it has a lot to do with rituals. So many performances are based on rituals. And I would also say that because my performances are mostly linked to my personal everyday life. So somehow it's also for me a moment to digest what I experienced. And in this sense, I think not all of the performances, but at least the ones I also presented here can also be looked at as rituals. Yeah.
Thank you. Any other questions?
Sorry.
Oh, yeah. Go ahead.
I found it interesting that two of our artists are experienced IVF and sort of the differences of going through that. It changes the arc really. And I was wondering if both of you could maybe speak a little bit more on how that changes the arc of expression in your art. Yeah.
Yeah, I was really excited, Irini, by your talk, and to just feel like, oh, she's speaking my language. Like I know all of this stuff, all of these terms, all these medications, especially right now because I'm in the thick of it again. But I think that for me, the IVF process became so much a point in my work because it really forces you to learn and talk about exactly how your reproductive system works. Like I think most people that get pregnant naturally, like just it feels like a miracle, right? But there's actually like this system of like all these different hormones firing at exactly the right time, and that's what you are replicating with IVF through all of these injections, all of these different ways of assisted treatment. And so I think for me, especially in 2020, when I first started this process, the thing that was so striking was that language that was being used. And so like it was just such a obvious parallel to my upbringing so quickly. All of this, I mean, seriously, using the word harvest on someone's body sounds so kind of violent in some ways. And when you think about egg harvesting, and then I think about cranberry harvesting, and it's such a interesting parallel too, because like they're very similar in shape, right? And so that's why it comes up in my work visually so much too. The idea of an egg anyways. And so I think, yeah, for me, it just like opened up all this research that I wouldn't have otherwise done, right? I wouldn't have been forced to learn about, oh, why do I have to take progesterone for 9 weeks of pregnancy in IVF, and why don't people have to do that normally? It's because your body naturally produces this corpus luteum around your baby that produces progesterone in a natural pregnancy. And so you are simulating that in IVF. And I just think that's so fascinating. As much as I bemoan it, like it is awful to do injections every day for 9 weeks into 9 weeks of pregnancy. But, it's because you are trying to mimic that natural process. So, and I just think it's so fascinating that we figured all of this out, right? And I'm so thankful for it, as hard as it is. But yeah, I'm curious to hear Irini's thoughts.
Of course, it changed everything. The simple fact to be labeled infertile, because I wasn't even conscious that I had eggs. Although I had my period, I wasn't aware of having eggs. So all of a sudden,
the eggs or the non-existing eggs were monitored. And all this monitoring of the body, like temperature and urine and all kinds of blood tests that were made all the time. I really experienced them as a huge intervention, and the medical court taking control of my body, or trying to take control of my body, and I experienced it as something that was really very violent. And so I started to work on this experience by collecting different kind of materials, like ranging from art history, depicting angels, which I saw as babies in the end, to biomedical data and information on reproductive technologies. And I started to mingle them, and I also started to collect all the materials used for the fertility treatment. So I kept all the syringes and all the packages of the medication that I got, that I took. And after 5 years, I got pregnant. And when I was pregnant, I knitted a bag for all these packagings, which is called now the snake. I didn't show it here. But of course, this experience strongly influenced my perception of my body and also my artistic practice. And I saw in Alexandra's paintings the bodily experience of being pregnant, which is quite weird, actually. So, and I also very much appreciated Linda's experience of being a mother and living it as a performance, as an everyday performance, and not being disconnected from art practice at all.
Thank you.
I have a question for Magdalena. I am just wondering, like, I'm just blown away by the artists that you shared with us, and really fascinating. And I consider myself to be pretty well, like aware of a lot of artists that are working in this field of like art and motherhood, birth. But a lot of your artists were new to me. Do you think that is because the Polish art world kind of like is its own and its own kind of bubble, or do you think that's just like that they are kind of in your world? I'm just wondering, yeah, are they well-known artists, or are they less more obscure?
Thank you. I'm really glad you like them. I have a lot more, but not that's the real reason. There's not as much as I think I would like them to be. I mean, there are just a few more, and I'd love to share them. For example, the work Anna Buczkowska, the Birth, from 1975. It's actually a work that she was part of the School of Textile Art, Polish School of Textile Art, and the only well-known person from that is Magdalena Bakanowicz, and no one else actually. So my work is usually also in archives, and I try to find names that nobody really knows and nobody really remembers them. But those contemporary artists, Iwona Demko is pretty much well known.
I think Małgorzata Markiewicz also, but as I said, there are probably maybe a few more. I don't know. Is it because of the bubble, Polish bubble? I'm not sure. Maybe it's because of the topic. Maybe that makes it not really so popular. But there are some few wonderful examples, and I'd love to share them with you, so I can email you after.
Yeah, please do. Yeah, and I applaud you for bringing these artists to light more, and to bring them out of obscurity. I think, especially in a conversation like this, where all the eyes and ears will be really interested in this audience and that work.
Yes, go ahead, Philippe.
Philippe, I'm sorry, my name is not like that, but I don't know how to change it. If any of you knows how to change it, please let me know. Well, I would just like to ask Magdalena. I'm not sure if she said, where are these wonderful life-size replicas of the female anatomy from 1756 by Angélique Marguerite Le Boursier? In what kind of space are they? Museum?
Yeah, they're in museum. One of them is for sure in Paris, and the other one is currently or was in Warsaw. There was a huge exhibition about women's artists, and there was this Le Machine, and I saw it personally. It was quite an event for me. So yeah, it's exhibited. It's not hidden anywhere. It's in the museum in France, in Paris for sure. And
but what museum? Sorry, what museum in Paris?
Well, I cannot remember right now.
All right,
I can check it for you.
All right. But it's in a museum. No, I was just wondering,
yes.
I would like to know more of the history, because in Bologna and Florence, you have many 18th century anatomical, but in wax, and also many of them related to birth. Many collections of 18th century objects made of wax, but they were used by doctors, and they are in two museums in Florence and Bologna. But I didn't know about this made of this material. Thank you very much.
I have like a follow-up question, because if I understood it right, like this object Philippa just was talking about, it was meant to be like, it was made for educational purpose. Is that right?
Exactly.
And so, because I was, but maybe now you already also answered this question already, because I was wondered, like whether this woman, was she an artist herself, and where are these objects now exhibited within the art context, or within the context of history of educational objects, or I don't know. So I was very curious to know like a bit more about this person. Like, did she see herself as an artist, or if you can tell a bit more about that.
She was a midwife for sure, and I'm not sure if she saw herself as an artist. She was a midwife, and was creating just these for training, and that's it. These phantoms, as I said, they are exhibited in Poland. I saw them on the exhibition of art, so they are currently as an artwork more, I think, than obstetric or some museum of medicine or so on. But I will check this Paris thing, because I'm sure it's there, but I don't know the museum. I saw it in the context of arts, and I think it's wonderful actually. But yes, it was created as a phantom, as a mannequin.
I'm here talking from Paris, so I just wanted to say that I think this machine is in the Natural History Museum in Paris, so it's not really an art context. So yeah.
Thank you. I really think it can be in both these contexts, because as it was due to the medicalization and so on, I think it's fine that it's both here and here, as well as there are various of these phantoms. It's not only one. There are few for sure.
Yeah.
Alexandra, I had a question for you, which is actually, so I've met Alexandra. She's in California. We haven't met in person, but we've talked on Zoom before. And I've seen some of her work, how it's been developing. And I already brought this up with you, but I thought I would bring it up with the group, which is that I see that she is doing representations of pregnancy and birth, but she's also, in her artwork, I see a lot of like the representation of the sensation of pregnancy and birth. So not just like, we're not looking at like some narrative form of the pregnant body. It's like you sort of feel the pregnancy or feel the birth. So I don't know if you want to, I kind of just wanted to mention it as a comment, but if you wanted to say anything about that, that would be
Yeah.
great.
Yeah, I think that's something I've long been interested in all of my work, even before getting into more motherhood territory, is like how can I get into the visceral or even emotional feelings in the body in a visual way, right? Like how can I create that in the viewer? How can I kind of transfer that? And so like when I was in grad school and making work, I think that was like coming from a more emotional place. Like I hadn't had these like extreme experiences within my physical body yet. You know, I had not been pregnant yet. I had not had that experience, but I was still really interested in this idea of the explosivity of the female body and the way that we explode. So that's both like physical and mental in a way, like emotional, how we are often depicted as being these much more emotional, effusive characters. So that's always been an interest of mine. And then, so once I got to this point of IVF and pregnancy and birth and those being such intense experiences, it just was such rich territory for making work that continues to try to do that, to try to get to those visceral feelings. And it's funny to think about something like a fertility figure, you know, these like little figurines that you see in like museums of natural history that people made so many thousands of years ago, and them holding them in their hands. But thinking about how can I describe those in a way that also describes like something really internal and really just really like tingly and intense. And so I think like for me, bringing the berry into that, that's why with my title slide, using that image where she's really weighed down by those berries. It was so real for me, that feeling of finally being pregnant after like so many years of like wondering what it would feel like, and you know, years of trying to be pregnant and then finally getting there and really meditating on that feeling that is so otherworldly. I mean, I think for me, especially the feeling of having another being move inside of you is so crazy. And just and the weight and the edema, all of these things that I think people we certainly talk about as like, oh, these symptoms of pregnancy that we go through in like this medicalized way, but people don't describe what that feels like enough, especially because it is kind of like a tiny blip of your life. I mean, 9 months, it's long enough to really feel the feelings, but it's short enough that it's only a fraction of your life. So I think meditating on those experiences was a really nice place to think about. And then also postpartum. I think postpartum is something that's so under talked about because there's so much going on. There's so much bleeding and there's so much, whether it's prolapse or like just like this falling feeling, plus the breastfeeding and just that all these other ways of feeling both engorged and leaking. In addition to the way that we like, the fact that we have a monthly bleed, that's also part of this like idea of the explosive body. So I think for me, it's just been, yeah, it was just like it was so ripe for me to mine these experiences for what I'm interested in terms of like exploding that body on the canvas, really. Yeah. Thanks for that question or that prompt.
Yeah, thank you. I'm going to put in the chat a website that I've been running since 2010. I started it when I was 3 months pregnant with my second child, and it began as like a personal kind of meditative thing, but it turned into a much larger project that has kind of informed some of my scholarship as well. But it's really devoted to art and talking about one image. Now I do one image per month, and I've written about Alexandra's art. So for all the artists here, if you would like me to do a post about your work, please just send me an email and, I would love to write about that. And you can check it out over there. Any other questions?
And I have one just technical, kind of boring question.
Yeah.
When will we have access to the recording of these talks? Because I definitely will want to re-listen to some of these because they're so
Oh,
interesting.
yeah. So these will come out. The first thing that I'll do is email the participants, and anyone who does not want their recordings shown publicly can opt out of that. And then after that, we have to go through the editing process. That can take a while. It may take, 1 to 2 months to really get them and then get them out onto YouTube.
Gotcha. Cool.
Yeah.
Well, I'm glad you're sharing them.
But they will be available. Yeah.
Yeah, that's
Mhm.
awesome.
Yeah. Anyone else? Okay, well, I think that then we'll conclude this session, and we will be coming back at 11:45 my time in California. So that's in about 15 minutes for session 2. And Marianne Delaporte Kabir is going to moderate that session. Beatrice. Okay, so I think we can start. Hello, everybody. All right.
Right.
So let's see here. Okay, so uh, I'm Anna Hennessey, founder and director of the Society, and I'm going to pass the mic over to Marianne Delaporte Kabir, who she is going to be our moderator. So go ahead, Marianne, it's all yours.
Welcome, everybody. So this is our second session of our first day. And the title of this session is Aesthetics in the Philosophy of Birth and the Phenomenology of Coming into Being. And we have 4 wonderful presenters. I will be giving you a 15-minute warning when you've gone to 15 minutes, just so that everybody knows where we are. And I'm happy to see that Beatrice is working, because I know you were having issues, so I'm glad that's going well. Our first presenter is Beatrice Sasha Kobau. I'm not sure how to pronounce your last name, I'm sorry. She received a PhD in philosophy from the University of Leipzig, where she also has her vinia. She works on questions of meaning and permanence and sustainability. She teaches philosophy in Salzburg and in the Arcus Alliance. She currently lives in Germany with her family. And her paper title is Visiting Icons of Hyper-Maternity and the Sublime Experience of Birth with Kant and Cavarero. So Beatrice, it's up to you to share your screen.
Yeah, thank you. So I'm doing this in my daughter's room with a hotspot. We'll see how far we come. But I am excited to share my first slide with you because it relates to our actually our section. So even if I were to give the talk tomorrow, I'm happy to show you this very first slide. Can you see it?
Yes, we can.
Okay, wonderful. That's great. So good. Okay, so I'll start. It might be too slow. My connection might be slow.
Okay.
But I'm going to give you this slide in any case. So I realized that I actually had waited for the symposium the entire time since our last symposium. So I'm very excited to be here. And so this is the slide that I would like to open our section with. It's titled, as we've just heard, Aesthetics in the Philosophy of Birth and the Phenomenology of Coming into Being. So it's by Hilma af Klint, and it's from a series entitled Primordial Chaos, which the artist completed in 1906 and 7. So in which she worked on this cosmic primordial becoming. Becoming, I think, is the movement which unites the cosmic with the individual, and it unites our species with other species, and one generation of humans with their generations that came before, and also the future of humanity. So I think becoming will, for the philosopher, be the key in which to read sources and towards which to direct systematic thought. Af Klint is interesting to me in this context as an artist because in her person and oeuvre, she overcomes boundaries which traditionally delineate subjectivity, and she substitutes them with a sense of openness towards process and the experience of the sublime. So even if I can't continue with my talk tonight, I'm very happy that this first image can be the first image of our section on the aesthetics and the philosophy of birth and phenomenology of coming into being. So how is the reception? Is it okay? Should I continue?
It's good now. Yes, keep going.
Okay, good. Let's see. Okay. So here we see my sources, or at least some of them. In her 2016 book, Inclinations, Adriana Cavarero offers a critique on the position or stance of rectitude. You see it here. It's called A Critique of Rectitude. And one of the main proponents of the philosophical reconstruction, which is validating this stance of rectitude, is Immanuel Kant. Parallel to the upright subject of philosophical enlightenment, which is autonomous and negates any of its inclinations, Cavarero conceptualizes the inclined subject. She does that with, but also beyond Hannah Arendt. And the subject is bent towards others, and it's open to the world. Here we see Cavarero's two more recent books. One is on icons of hyper-maternity, and the other one is on the Song of the Sirens. And both of these books further explore the subjectivity of maternity or the maternal. But already in Inclinations, Cavarero warns us, she writes, for those who want to attempt an exploration of this issue, and here she means the birth as a central category of ontology, however, there remain many obstacles in the way that make it a very difficult undertaking. From the aforementioned tendency to censor the stereotype of maternity, an issue which has many different sides in feminist thought, to the all-encompassing biopolitical paradigm which aims at limiting birth to the domain of mere procreation. In my talk today, I will read these two sources, Cavarero and Kant, side by side as allied rather than opposed sources. And I would like to use both to appreciate the experience of birth and parentage as one of becoming and self-understanding. This appreciation shows us how the two worlds of which we partake, still strictly divided and opposed for Kant in his conclusion to Kritik der praktischen Vernunft. One side of the tierisches Geschöpf, the biological creature, which has its place in the external world of the senses, vis-a-vis the invisible and intelligent self, which is governed by moral law. How these two worlds are bridged by the experience, or by experience and sometimes by aesthetic experience. It is thus an aesthetic experience par excellence in a Kantian use of the term. Baumgarten, and here you see Baumgarten's Aesthetica. Aesthetics is the first text to introduce the term to delineate a proper subdiscipline of philosophy. And it is Kant's breviary for his own lectures. And this text refers explicitly to, when it says aesthetics, it refers to a science of acts of acquiring knowledge with the senses. In the original, it reads Aesthetica est scientia cognitionis sensitive in the Prolegomena. So Kant, in his Kritik der Urteilskraft, develops a theory in which the faculty of judgment, according to the senses, functions as Übergang, as bridge or nexus between the realm of nature and the realm of intellect. And Cavarero develops another such theory in her rereading of Maternity. The experience of birth and becoming is, I argue, necessary for our enlightened self-understanding. Partake of the order which you see here, presented in different ways, human beings not only as part of a cyclical and renewing physis, nor primarily as vivipars animals, those which bring forth living beings of themselves, or mammalia, beings which nourish their young with their milk-producing mammary glands, but I think as generationally inclined beings whose existence depends on the life of generations. But first, let me remark on the two orders of the self which seemingly oppose Cavarero to Kant. The terms autonomy and responsibility on the one hand, and visibility and newness on the other can be attributed to these two orders of subjectivity. The Kantian subject is defined as maturing and rational according to how autonomous and responsible it is. And here it is first and foremost responsible for its own rationality and its own rectitude. While in the Arendtian line, the focus is on the appearance of the subject, which becomes visible in the shared space of agency, and which guarantees both its own ability to begin anew and the community's ability to move forward. I think you can see already that these terms are not really contradicting each other, and that they might be tangential rather than orthogonally positioned. Cavarero insists further, and critical of Arendt, on the mundane and real and everyday inclination which individually, concretely embodied and vulnerable people or selves have towards each other. And this for her is exemplified in the Renaissance Madonna with Child. So I'm quoting here, quoting Cavarero from Inclination. The smile and inclination of Leonardo's mother, and this is the canvas Saint Anne with Virgin and Child, which we'll see in a moment, suggests that there is a carnal sense of existence as mundane as it is prosaic, that consists primarily in her irrevocable inclination toward the other, which is there in plain sight for all to see, yet hidden to the ennobling eye of theory. So, moreover, my focus will not be on the ontology of the subject, but rather on the phenomenology of birth. That is, my efforts today are concentrated in the area of aesthetics or judgments concerned with sensual experience, and my aim is to illuminate how the experience of becoming, which is sometimes mediated through art, provides important insights for our own subjectivity. That is, it helps us understand ourselves as subjects. And I think here, Arendt, Cavarero, and Kant's ideas are complementary. So now we come to the first part of the title, which is the Sublime. Immanuel Kant asks how the experience of the Sublime, das Erhabene, can be pleasurable since it is characterized largely by displeasure, by awe and fear. And I think the experience of giving birth is governed by the same duality. It is rapture and pain. My remarks today I take as part of our communal investigation into how birth has a phenomenological dimension of ecstatic experience. The images we see here the ocean viewed from the chalk cliffs of Rügen in Caspar David Friedrich, or an image of Earth taken on the latest moon mission to the far side of the moon. It's an Earth set, might provoke the following response in a viewer, and I quote from Kant, Kritik der Urteilskraft. Bold, overhanging, almost menacing cliffs, thunderclouds piling up in the sky, accompanied by flashes of lightning and claps of thunder, volcanoes and all the destructive fury, hurricanes and the devastation they leave behind, the boundless ocean in turmoil, a towering waterfall of a mighty river, and the like. All these make our capacity to resist, when compared to their power, a mere trifle. But the sight of them becomes all the more appealing, the more terrifying it is, provided we are in safety. Yet Kant concludes that although a movement of the Gemüt, and I think maybe he means here mind, is provoked by the encounter with the vast, the quality of sublimity does not attach to objects, but it is a quality of the mind itself. I quote, thus the vast ocean, churning with storms, cannot be called sublime, but instead the mind already has to be filled with various ideas if such a sight is to evoke a feeling that is itself sublime. That's the quote. So for Kant, it is a fountain of ideas that's sublime. And now I want to remark on these two things we see here as actual images, so representations. They're already mediated, so our viewing is in some sense a second-tier viewing. It's reflecting itself. We see in the Caspar David Friedrich canvas, we see these viewers, and the Earth set is a picture which is we have a media-induced knowledge of this person that is aboard a spaceship taking the picture. So not only that, but also these images are meant to occasion, to move our mind to a particular insight. So Kant thinks that they are intended to be moved to contemplate the infinite, and that is for Kant our own rational capacity, which really exceeds our physis, which really makes us immune to any assault that we might suffer in our embodied selves. So here's his conclusion, Kant's conclusion, that thus sublimity is not found in anything in nature, but only within our minds, insofar as we can become aware that we are superior to the nature within us, and thereby also to nature, insofar as it influences us outside of us. So this is his idea. His conclusion is that we can become immune to a thought that we are really superior to nature. And I think interestingly, you see the reverse of this thesis in Cavarero's Hyper-Maternity. So in Cavarero's Hyper-Maternity, physis is that of which we become aware and stand in awe, and which rather than being that which is overcome is a superior and also destructive force, can be destructive force within us. The ability to create an abundance is both sacred and awe-inducing. And this is how in Euripides' Bachen, the messenger gives an account of the Maenads' boundless power, which is instilled in them by Dionysus. So in the play, the women of the city, Thebes, have left the confines of civilization in the city and have become drunk with physis, I want to say, which is instilled by Dionysus, and they have the ability to bring forth excessively. So the messenger comes back and tells a tale. Breasts swollen, and I quote this from Euripides in a translation. Breasts swollen with milk, new mothers who had left their babies behind at home, nestled gazelles and young wolves in their arms, suckling them. Then they crowned their hair with leaves, ivy, and oak and flowering bryony. One woman struck her thyrsus against a rock, and a fountain of cool water came bubbling up. Another drove her fennel in the ground, and where it struck the earth, at the touch of God, a spring of wine poured out. Those who wanted milk scratched at the soil with bare fingers, and the white milk came welling up. Pure honey spurted, streaming from their wands. If you had been there and seen these wonders for yourself. You had gone down on your knees and prayed to the God you now deny. And this is Dionysos. In the sense of hyper-maternity, the philosopher revisits descriptions of Dinos, and then Dinos means awful, so it describes awe-inducing awful, and it describes, I think, also really aptly the experience of the sublime, as in Kant. And so here's the summary of the first part of hyper-maternity. Cavarero reestablishes the idea of a nexus between nature and mind, although her order is reversed from Kant's. It is not the mind which understands itself superior to its feeble biological condition, but the extreme state of maternal physis which gives birth to the non-material. Cavarero assumes that we cannot make sense of rationality or subjectivity without their material embodiment and maternal origin. So rational as birthed and birthed as rational beings, we are at the mercy of Dionysos, and at the same time, we are Apollo himself, all rationality in pursuit of truth. So now we come to the second aspect of hyper-maternity. The wish to deny the body, which is a famous trope of Western philosophy, corresponds to the wish to also deny the mind, attributed to the subject giving birth, and it is an infamous trope of equating women with unthinking nature. A continuation of this line of argument is, I think, found in today's transhumanist project of overcoming the biological conditions of our existence. The denial of body and mind as biological conditions of our existence denies becoming. Kant, now he's going to cross over into the camp of Cavarero when he writes about the appropriate response to the experience of sublimity. So this is Kant on how we should react to the experience of the sublime. He says, das Gefühl der Unangemessenheit unseres Vermögens zur Erreichung einer Idee, die für uns Gesetz ist, ist Achtung. So it's the response of esteem or respect. And this is how Kant describes the appropriate feeling accompanying the realization that we lack the ability to represent or reach an idea, which nonetheless is governing us. So I think that that's actually a really great description of what Anna has just described to us also. But I want to take this a step further because I think that in ecofeminism, ecofeminists point out that in industrial appropriation and reproduction, the locus of exploitation is often the maternal body. Maternity as physis is then not respected but abused. Matricide is not just, as Cavarero's reading of the Great Mother shows, a cultural event of the past. The denigration of the maternal and disregard qua exploitation denies that they constitute us in the process of becoming. And now we come to the last movement of the argument, and there we return to Leonardo's painting, Saint Anne, Virgin and Child, and to the theme of inclination. And I will give you 3 readings of this painting. Here's the first reading by Fra Piero de Novellada, and he saw the canvas when it was still in the workshop, and he writes in the description, the Christ child, turns toward a lamb and seems to be embracing it. The mother, who is almost rising from St. Anne's lap, holds the child firmly to keep it from the lamb, a sacrificial animal symbolizing the passion. St. Anne, rising slightly, seems to want to restrain her daughter so that she does not separate the child from the little lamb. Anne may be meant to represent the church, which does not want the passion of Christ to be prevented. So this is our first reading, onto which Cavarero overlays her own reading. And here we are at the second reading. In Leonardo's painting, which confirms the general system, and here she was referring to the genre of Anne holding Mary, holding the Christ child, which was popularized from the 13th century onward. The Virgin Mary sits on her mother's lap and supports Mary, almost anchoring her, as if helping her to lean outside herself in her inclination for her child. Rather than holding Mary back so that Christ would not be spared his sacrifice, in which case Mary would represent the church, Anne instead allows her to bend. The image, in a sense, suggests that every mother has had a mother, following a potential infinite series of unilateral inclinations that are first received and then given. So this is our second reading, which is Carework. Hans Jonas takes up Hannah Arendt's idea of newness and of visibility and links them with the concept of autonomy and responsibility. If we remember, that was our first four categories. In his book, The Imperative of Responsibility, which is a rewriting of Kant's categorical imperative for the future of humanity in general. And Carework has a part in which she criticizes Hans Jonas's interpretation. Despite this critique on Hans Jonas, I think his conception of responsibility is especially apt in bringing out what it means for our self-constitution, that we are beings in this infinite series of becoming an inclination. And so our third reading is with Hans Jonas. It can be so in one way only. Respecting this transcendent horizon, the intent of the responsibility must be not so much to determine as to enable, that is, to prepare and keep the capacity for itself and those to come intact, never foreclosing the future exercise of responsibility by them. So the proper subject of philosophy is then not the certainty of personal death, which we expect and which fills us with anxiety and dread, but the certainty of birth, which has already dedicated us to the order of the living. The experience of becoming places into our hands the responsibility for the other, not as vulnus or wound, as Carework describes it, but as an agent, the gentle becoming of whom is indeed the very content of our agency. And I would like to conclude with this very ancient work of art. It's in the Cueva de los Manos in Argentina. The handprints at the site were created 13 to 9,000 years ago, using a technique known as stenciling. The artists blew pigment through hollow bones or reeds to create negative impressions of their hands on the rock surfaces. These impressions vary in size and color, suggesting that they were made by people of all ages and genders, creating the representation of a collective identity of us as generational beings. So in conclusion, in the sublime experience of birth, the finite individual grasps both its finitude and its connection with infinity, and experiences both tremendous fear and joy, just as Kant predicted. Thank you.
Thank you so much, Beatrice. That was a great ending. So our next speaker is Barbara Renzi from the Berlin School of Business and Innovation, and she will be, let me see, she is a philosopher and psychologist whose work explores the intersections of feminist aesthetics, embodiment, and myth. She holds PhDs from Roma Tre University and Queen's University Belfast and teaches philosophy, psychology, and cultural studies in Germany and the UK. And her paper title is The Body of Grace, the Feminist Sublime and the Aesthetics of Gestation in the Virgin Mary.
From the beginning. So I'm not working in the School of Business Administration anymore. I'm from the university now, just a little thing. And so I haven't used so many images and I feel guilty, but I have a very vivid imagination. Can you hear me? Yes?
Yeah, we can hear you.
So,
very good.
Yeah, probably because I have a very vivid imagination. So, and so we go, and then it was too full for me, all the PowerPoint. So there were images and I went out. Yeah, we're going to speak about summary because I'm Italian. Okay, so maybe I have to face that sometimes, and in my life, and it's very popular theme in Italy, summary. So, and we're going to map the argument. So we're going to speak about classical sublime, which I don't pronounce properly, probably. We're going to speak about feminist revision, Mary as a case study, and pedagogical states as well. And all of this is wrapped in aesthetics as well. So, let's see pregnancies as an idea of feminist sublime, and especially the case on summary. Why we want to do that? Because we can see it's, I mean, it's a form of overwhelming and transformative experience, which is not outside, is inside the body itself. And so we move from this argument of classical aesthetics, feminist theory, Marianne theology, and visual arts. Let's move there. So we have these two guys, very famous, Burke and Kant, that we all have to study school. At least when we do history of philosophy or at university, are very important. And they have, okay, the Sublime, and then we study when we read poetry, and and we have this encounter with the external world. We imagine that, a cliff or something, a storm, a vast ocean, and we have the pain, the danger, the self-preservation in both accounts. And when we look at them, I mean, imagine them outside the sun. There is a kind of a window. No, we look at them, and from a position of above, and we are shaken, and that's it. And so we are, there is the distance of the observer, there is this kind of window, and we have this distance. And I find this very masculine, just because we go over and we try to take this. And so it's a side, this sublime is a side. But I think something gets left out, especially for us women. No, it's an experience sometimes in maternity of internal transformation of the body, of and it is rooted. It's different because we say yes to the sublime, and we say yes because we can be vulnerable and open at the same time. So we have this pregnant body as a side of a overwhelming encounter with ourselves, with external reality, with something, different, And I see agency as that, not that we control, but is receptive. We open, we decide to say yes to the open, to the mystery, to the divine. And so let's go about the feminist sublime, and it's her. So pregnancy, childbirth, she argues, philosopher Sheila, that let's go give a different look. The pregnant body does not stand before something overwhelming; it becomes the very site of that overwhelming encounter. So we have pain, danger, radical physical alteration. We have seen before beautiful images, great artists, And so we have the proximity of the new life. And this is an experience that is both beautiful and terrible, precisely because, and this is the texture of the sublime. So this is a totally different experience. No, the body goes through radical transformation, and there is, and we don't have control, or we don't have even full comprehension of what's going on with me. Who am I? And there is vulnerability and risk because, guys, every time we get pregnant is very much a danger, it's pain, it's a physical exposure, it's a pain sometimes, It's not just this beauty that is there. So we don't have this aesthetical distance that we can look at the danger. The danger is in us, the sublime is in us. No, she's totally right. And so it's not, it's not outside. And we have also the encounter with the infinite because we carry the experience of another life that goes beyond us, or we are being inhabited, and and we feel more the limits, our limits. We feel that we can expand, but we feel our limits as well. And agency is something different in this case. No, it's different because we don't master, like, they want to master the tempest, they want to control. We master through openness. We master through consent. We master with the thing, I can change. I want to change. I want to be others. So, and this me and the images. So you have, these are very famous images as well. Oh, what's happened to here? And let's go with the case of St. Mary. Okay. So we have, this is Madonna della Francesca, and this is in Madrid as well. This is Annunciazione in Madrid. And let's go with that. Let's go with the concept. Okay. So, I don't know. I grew up in Italy, so I'm partially Catholic, there is this idea that, there is this idea that we imagine that if I close my eyes, I imagine this moment with the angels, pure light. I see the blue. I don't know. This is the way which I grew up. So we have Mary, ordinary life, domestic, quiet. But and then and then she says yes, okay. But, and I'm not the first one who says that, the question is not the voice of a passive obedience. It's the voice of a person that says yes to something that is big, it's open, it's agency. We've seen before, wise agencies, because she's vulnerable, she decided to become vulnerable, and she decided to know the infinite. So it is the voice of a reasoning and body subject who recognizes something that didn't happen before. She's the first one, didn't happen before. It's overwhelming, and she's been asked of her. So the sublime enters. It's not a mountain. She doesn't see from the window, says, hello, sublime, how are you? I'm fine. It's here. It's inside of me, in me. And she says, yes. So, so in Latin, we say, fiat, let it be. Mary's response is an act of informed consent. She says yes. She's heard the message, she wrestled with the implication. So then if I look at the thing in this way, the fiat that she says yes, it's agency, I don't see her come. I see, different lights. I mean, if I would paint it, I would paint it with bold colors. I would paint it with a different light, the light that comes from inside of her. The decision be open, being, when I be open, when this come inside of me, I'll be vulnerable, I'll become something else. I'm curious. I am the infinite. And it is the agency of a transformative openness, a willingness to be the side through which the impossible become actual. This is will, this is strength. This is a radicality, different model of strength, that I'll conquer the mountain. I'll conquer the storm. I'll win. No, I'm so strong that I can decide to become something else that I don't know what it is. And this is the first time that happened. And every pregnancy is the first time. So, yeah, that's it. So, Mary agency is a different grammar of power. The Western philosophy tradition has tended to define agency in terms of autonomy, but here we say openness, consent, relation, vulnerability. So the importance of being relational, of being vulnerability. And this is the ethic of relation. This is the ethic of vulnerability that give us another aesthetics. No? So it is a form of courage. Every time you get pregnant, we are really courageous, when we decide yes. And so it's the old Kantian book philosophy, they don't have a name for this, I think. So the incarnation of the body is very important, and the infinite does not overwhelm from outside. It's inhabits, grows, and nourishes from within. Mary body is important. It's not a passive vessel. The body is important. We don't have this dualism anymore. The incarnation is not an abstract event. It's blood. It's pain. It's breath. It's tissues. This is what is, the sublime. She's an active theological side. So the risk of idealization, it's, and the risk of idealization of each pregnancy, and all these pictures that are beautiful, and these adverts that are beautiful, and we have the perfect family and everything else. But, it's much more than that, It's much back. There is humanity. We have to take humanity seriously, to acknowledge that she experienced the full weight of pregnancy, physically, vulnerability, the social exposure, because we are always how you do that, in different ways. And, including the violence that we had at the end. So we can look at this to Kristeva eyes, and she worked a lot on that. And I don't know if I have the time, but this can be seen in this way as well. So, and so, you know, it's not my ideas coming from, I just push it a bit, coming from her, no? The Kristeva move name what is suppressed, so the complexity into the maternal body. Every time we have sex, it's very dangerous for us. Every time you can die. Every time. So, and the idea of objection, Kristeva objection, the feeling of horror discussed with experience when something breaks the boundary between the self and the other. So the sublime. It's clean and clean in life and death. It's dirty. We don't know who we are anymore. So the fiat is something more, no? It's something more. It's not a passive, it's a fiat. It's something, a fiat mihi is something more, it's a radical thing. We are radical, we are open. And in this openness, the ethics, the pedagogy of life, the pedagogies of relationship, the ethics of society, this openness should be based on. So agencies is an exercise under condition of deep unknowing. When we are in a relationship, we don't know. We consent in this case of becoming something else without a full comprehension, because until we are not there, we don't know. And this is a philosophical, aesthetical, and an ethical act on which the society should be based, in my view. The fiat as a model of situated embodied decision-making, and is not silence of submission. The maternal body is never a passive vessel. The maternal body is an active site where the divine become legible because life is there. So we don't have the transcendence that descend into the body from outside. It's the mother, it's the transcendence itself. And it comes from the body. It's a bodily process. It's made of smell, of pain, of change. The transcendence, the sublime, is a bodily process, is vulnerability, is a relationship, is care, is care. The flesh is the medium of our ethics, is the medium, it's not the obstacle. So we have this dualism, we don't like that, it's clear, no? And, you know, we have different, Pietro Francesca show you a picture, there are few one that, you know, but I like to imagine with your eyes a different version of Mary. And I'm going to close because I don't know about the time, but I think that this can be seen also from a different perspective, you know. The final thesis is that the vulnerability is just is knowledge. So from the sublime, we get to the knowledge, step through the body. And the body is transcendence. So we should give a different idea of what is the body. So the vulnerability can become knowledge, and the body can become a place of transcendence. So we should have this sublime, which is dominant. Oh, it's not our model. It's not for me that I'm a mother, that I chose to become a mother. And it's not for everybody who choose to become a mother in different ways, not just carrying the baby inside of you. It's embodied learning is a legitimate mode of knowing. Vulnerability is a pedagogical virtue, is a virtue. It's not a deficiency. We are vulnerable when we carry life. Okay, but this is a virtue. And we have inside of us the transcendence. So, yeah, if you look at this way, I'm not the first. There are lots of people to talk about, you know, it's, you know, at least I grew up with a model and I see another model. And, you know, it's a model of feminist and relational ethics there. So from the sublime, we go to a pedagogy of vulnerability. And, you know, because vulnerability and the sublime brings without vulnerability, we cannot have the sublime. And I think it's in this case studies, you know, which is, you know, for my culture, for where I grew up, it's an important case study. It's a way of knowing, you know, it's a learning conceived through Mary figure is the foregrounds of openness to transformation, tolerance, tolerance of the unknowing. When you learn, when you live, you have to be tolerant of what you don't know, what is becoming different, because every time you meet somebody, you change. And it's the courage that you have to consent the change, so to consent to live, to be in the relationship before the outcome is legible. So openness, yes. I say yes to openness, okay? And not to try to dominate from a window. We are the window. We don't need a window on the tarot. We are the window. Our body is the window if we accept it. And vulnerability. So we acknowledge the risk, but life is a risk. Every relationship is a risk. The risk of genuine learning entails to the body, and the transformation itself that allows encounter to reshape ourselves every time we decide to be open, because we can't fake the encounter, no? So transcended to the body and not beyond it. This is, what I think the case study is, and the feminist Sublime names this an experience of the overwhelming other that is not mastered from without, carried from within. So we have from the distance, we look at the window, we look at the storm from the window, but we go to the intimacy. And the intimacy is a condition of the sublime experience. From mastery, you have to master the tempest. We have the tempest inside of us. We have the storm inside of us. From the abstract reasoning, we have to the embodied vulnerability, which is knowledge, which is a side of transcendence. Yeah, so if we take Mary's case studies and we look with different eyes, and I could have put some other philosopher there, but then it was becoming a bit too complex. But we just leave, and say that I'm not the first one. I'm not, I took some lots of ideas from other people, other great people. So we just see that Mary and each woman that decided to become something else doesn't conquer the infinity. Is not annihilated by it. She bears inside of it, and she grows with it, and she changes with it. So the body, our body, is the site of revelation. It's not an obstacle to transcendence, and it's not an obstacle to reasoning. We are not emotional. Okay. Consent and vulnerability are forms of power. They are not signs of passivity. When I say yeah, I'm powerful. And so, yeah, I think if you can put together a feminist theology, aesthetic, phenomenology that and they are mutually illuminated, and they bring they open the road to pedagogy and to ethics. And I finish here. I don't know how was it with the time.
That was perfect timing, actually. You had a good sense of time. Thank you so much.
Very good.
Thank you.
Thank you, sir.
Thank you. Wonderful. All right. We will move on now to Christina Moraru. There you are. Christina is a researcher, curator, and editor from Iași, Romania. She has a PhD in aesthetics and is working as a lecturer at George Enescu National University of the Arts, and is coordinating a research project at the Institute of Multidisciplinary Research. And her paper title is Gestational Aesthetics, Beauty, Materiality, and the Phenomenology of Coming into Being.
I will now share my screen.
Great.
Okay, so I propose to talk about gestational aesthetics, beauty, materiality, and the phenomenology of coming into being. I'm using the syntagm the gestational aesthetics to explore how gestation, a concept which is primarily associated with pregnancy, but can also be applied to a broader process of creation and transformation. I'm investigating how this can serve as a powerful framework for rethinking aesthetics. So rather than approaching beauty as a finished, perfect object, gestational aesthetics invites us to focus to this process of emergence, development, and becoming. And in my presentation, following a couple of philosophical references, also informed by phenomenology and feminist perspective, I will explore how this process of formation challenge traditional aesthetics categories and reveals new manners of understanding beauty, embodiment, and creativity. So the central question of my research is, can we think of gestation as an aesthetic phenomenon? Because traditionally, pregnancy has been discussed within biological, medical, or social frameworks. However, gestation also presents a unique experience of transformation. It is a process through which something comes into being. So this is the phenomenology aspect that I'm correlating to this aesthetic research framework. So gestational aesthetics offers a framework for understanding beauty as a dynamic process of formation, vulnerability, and becoming, rather than a fixed, ideal, completed form. And here my argument is that beauty can be found not only in the completed form, because we have this tradition in aesthetics since Plato, we look at the form, but now let's look also at the process. Let's look at this unfolding process of becoming. Gestation therefore becomes a site where materiality and imagination intersect, and this offers us an extended model of understanding aesthetics, not only as the appreciation of forms, which is actually the main point of view in traditional aesthetics. So we are not talking about the static form, but we look into an engagement process. We look at the change, at the development, and we look at relational aesthetics. So why gestation matters for aesthetics? In classical aesthetic tradition, we often focus on completed objects that can be observed from a distance. Beauty is typically associated with harmony, balance, symmetry, and traditional aesthetics often privileges the finished form or the stable object. And there is also this idea of detachment, of detached spectatorship. And this is the perspective that I want to challenge by introducing this concept of gestational aesthetics, because I managed through these concepts to challenge this assumption, since I'm talking about a process that is rooted in uncertainty, a process that is rooted in transformation. So in itself, gestation emphasizes this transformation, relationality, and an embodied participation. And by focusing on gestation, aesthetic shift the attention from the object and the finished product to a process, to a creative process. And this shift repositioned the field of aesthetics from the contemplation of beauty towards the experience itself. And I would look into defining the gestational aesthetics, in my opinion, because starting from this hypothesis, gestational aesthetics examine the aesthetic significance of formation, emergence, and transformation. And here we are talking, on one hand, we are talking about whatever concerns the lived experience of a pregnancy and the aesthetic dimension of changing the body during pregnancy. But at another level, this can function as a broader philosophical framework for understanding how things come into existence. And this approach emphasizing growth and relationality. And here we are not looking at beauty only from a static perspective, but we are looking at something that unfolds through a process of development and transformation. So I want to share my philosophical background, some common references, because the idea of becoming is deeply rooted in philosophy. And I start with Plato, because he associated beauty with eternal and perfect forms, emphasizing permanence and transcendence. Afterwards, Aristotle introduces the concept of potentiality and actuality, suggesting that lived beings develop true fulfillment. And in modern philosophy, thinkers such as Nietzsche emphasize life as an ongoing process of self-creation and transformation. Also, Henri Bergson developed a philosophy of duration, describing reality as a continuous and creative evolution. And more contemporary reference to Gilles Deleuze further challenge these fixed identities by emphasizing multiplicity. I don't know if you can see multiplicity, difference, and becoming. So in this view, gestational aesthetics draw upon these traditions to propose that beauty emerges through a process, not through a fixed identity or a fixed state. I would like to engage a bit with the phenomenology, since through the lens of phenomenology, particular to the works of Merleau-Ponty, we can consider pregnancy as an embodied experience. Here, rather than viewing the body as an object, phenomenology understands it as the primary means through which we engage with the world. Pregnancy introduces a particularly complex form of embodiment. The pregnant person experiences themselves as being one and more than one. And the body becomes a site of shared experience. And then we have this fluidity between boundaries between self and other, and we have like a very interesting dynamic from a phenomenological perspective. And this experience, I think, that challenge conventional assumption about individuality, autonomy, and all this notion that we have all this stable category from aesthetics theory. Okay, so let's look in body as an aesthetic site. And we we'll start with this historical exclusion because historically representation of beauty often excluded or marginalized pregnant bodies because they did not conform to this idea of perfect beauty because of a lack of symmetry, maybe. However, contemporary feminist thinkers argue that pregnancy should be recognized as a powerful aesthetic experience. The pregnant body visibly embodies transformation, creativity, and emergence, and rather than being viewed as a deviation from beauty, pregnancy can be understood as revealing a different form of beauty, one that is grounded in change, one that is grounded in growth, one that situates ourselves in relation to the creation of life. And let's look at beauty beyond perfection, because I think this is the perspective that it's opening up with this idea. And I think this is one key contribution that the idea of gestational aesthetic bring forward, disregarding the traditional standards of beauty. Because we have this traditional standpoint with all these conventional ideas that often prioritize perfection, stability, control. And I think in this gestational aesthetics, we see beauty as becoming. We see beauty as transformation. Beauty is associated with this idea of possibility and transformation. And the value of an experience of form is not rooted in perfection, but in the capacity to grow, in the possibilities of becoming. And this broader conception of beauty allow us to appreciate the process that maybe are not perfect or are unfinished in the process of becoming, evolving, or maybe they are even imperfect. Gestation, I think, reminds us that creation is deeply material. It involves biological processes, bodily change, and interaction between organism and the environment. And in aesthetic theory, beauty is often associated primarily with the visual appearance. And gestational aesthetic expand this understanding by emphasizing the significance of material processes themselves. The formation of life is not merely something that can be observed. It is a complex material that is involving movement, rhythm, transformation. And this is why I think materiality and formation are two central standpoints for this kind of aesthetic experience. So I will have also some references from the feminist literature. I will go here to Julia Kristeva and her notion of the maternal. And because from a feminist standpoint, Julia Kristeva works offer an important insight into the maternal body and its relation to language, identity, and subjectivity. Kristeva argues that maternal experiences challenges conventional distinction between self and other, and pregnancy creates a situation in which another life exists within the body, which further on complicates the notion of individual identity. And for Kristeva, these experiences reveal a dimension of human existence that precedes fixed categories and stable identities. The maternal body becomes a site where transformation, creativity, and the aesthetic experience intersect. And approaching maybe the end or the final part of my presentation, I would like to engage also with matters of temporality, because I think here temporality is relevant, because gestation somehow changes or alters, give a unique perspective of time. Pregnancy unfolds according to development stages, and it makes this relation with time more meaningful. The future is anticipated, is imagined, and yet it remains uncertain. And phenomenologically, gestation creates a condition in which present is constantly oriented towards what is coming. And this creates a tension between present experience and future expectation. And I think this, it's a very beautiful metaphor. And also concerning time, I would like to think about the aesthetics of waiting. Because waiting, you can view it as passive or unproductive, but gestation changes this perspective, changes this assumption, because during pregnancy, waiting is active. You're not just staying, you're taking care of this state. You are anticipating, you are preparing yourself, you are imagining the future. I think this is a very interesting standpoint. Gestational aesthetics, therefore, reevaluates waiting as a meaningful and a creative activity. It teaches us that transformation often requires patience, and that emergence, it cannot be controlled or accelerated. It's a process that involves care and waiting. So let's look at gestation beyond pregnancy.
It's you're right, 18 minutes. Sorry, Christina, just to let you know.
Yes. I'm approaching my
Okay, good. Thank you.
Yes. Just think of, a bit beyond pregnancy, because although this was my main focus point, I want to think also to apply the idea of gestation more broadly, and to reflect on creative process that undergo this period of incubation, and how we develop idea, how we reach a state of maturity and then emergence. And to conclude, well, before concluding, let's look at a bit at why this research has a contemporary relevance. Because today, gestational aesthetics, I think it's a syntagm that can correlate very interesting philosophies, like feminist philosophies, many different art theories, feminist art theories, phenomenology, and medical humanities or environmental studies. And I think starting from this concept, we can start to create a new way of understanding embodiment, creativity, vulnerability, and interdependence. And I think this is relevant in a world increasingly focused on productivity, efficiency, and finished outcomes, because gestational aesthetic reminds us of the importance of process, of the importance of caring through the process. And it provides us an insight into many forms of personal, artistic, and social transformation. And to conclude, I think this syntax that I introduced, gestational aesthetics, invites us to rethink beauty through the lens of becoming, rather than focusing on the finish form, the completed form. It emphasizes emergence, transformation, and relational existence. And this is why I looked at this through phenomenological and feminist perspectives. And I showed how gestation reveals how beauty can be found in processes of growth, of creation, or even vulnerability. And this standpoint encourages us to have like a richer understanding of beauty, one that is rooted in care, in temporality, and this ongoing process of becoming. Thank you. Okay.
Thank you very much. That was wonderful. Looking forward to all of these fit so well together. So I'm looking forward to more conversations.
Yes.
We are going to finish today. Well, not finish. Maybe we'll be able to go back to our first speaker, but Anna Hennessey is our next presenter. She's a San Francisco-based author and artist who has published widely for academic and popular audiences on the topic of pregnancy, birth, and mothering in the humanities. She's the founder and director of the Society for the Study of Pregnancy and Birth and holds a PhD in religious studies. And her paper title is Sensation and Emotionality in the Aesthetics of Pregnancy and Birth.
Thank you, Marianne. Okay, so this paper looks at the qualities of sensation and emotionality in the aesthetics of pregnancy and birth, both in the actual processes of being pregnant and giving birth and in artistic representations of these processes. As the paper contends, it is often through these qualities of sensation and emotionality that the sublime is experienced during gestation and birth. The paper also considers the phenomena of sensation and emotionality in the aesthetics of being a mother, biological or adoptive, especially in the case of mothering infants and toddlers. Exploring an aesthetics of pregnancy and birth that emerges through the sensations and emotions felt during pregnancy, birth, and mothering, the paper provides a parallel study of the aesthetics of artistic representations related to those same phenomena. There are many understandings and arguments about what the aesthetic is in philosophy. Susan Fegan and Patrick Maynard, philosophy professors known for their work on aesthetics and the philosophy of art, have discussed it in their co-edited collection of philosophical ideas on aesthetics, how the term the aesthetic has historically pertained to studies of beauty or the aesthetic of art and theories of taste. However, they also provide examples of philosophers who think that any sort of thing or experience can be viewed aesthetically. This paper understands the aesthetic not as a value of beauty, but as a cherished aspect of human experience that can pertain to experiences of the body, art, nature, and other experiences. The German philosopher Martin Seal is one example of a contemporary thinker who has broadened the scope of aesthetics past the aesthetic of art and theories of taste to incorporate aesthetic experience, emotionality, and sensation. In his 2005 book, The Aesthetics of Appearing, for example, Seal states, quote, "We can react aesthetically to anything and everything that is anyway sensuously present. There are places where it is difficult not to behave aesthetically. depending on one's inclination, in the forest or in the garden, at an auto dealership or in a museum, in a concert hall or in a sports area, just as there are places where it is difficult to do so, such as in an office of a public authority, in a parking garage, during an examination, at the dentist, or at Walmart, end quote. In this paper, I contend that gestation, giving birth, and mothering have an aesthetic sphere that is experienced through the sensations and emotions that accompany them. I'm trying to change my slide and oops, let's see. Yes. Okay. Explored as part of this study are a number of philosophers who have looked at the aesthetic dimensions of art and life, including Sheila Lintott's feminist conception of the sublime as found in Gestation and the Giving of Birth, Gilles Deleuze's philosophical exploration of artwork that captures a representation of sensation in physical form, and Suzanne Langer's ideas on intuitive knowledge, human feeling, and sensory experiences in aesthetics. The paper proposes an aesthetics that emerges through the sensations and emotions felt during pregnancy, birth, and mothering, as well as in representations of those phenomena. In looking at art about the topics of pregnancy, birth, and mothering, the paper also acknowledges how responses to these representations may range from intrigue to disgust. Either way, there is also an aesthetic dimension of the artworks. The main theory of the paper underscores how there is a particular aesthetic found in the acts of pregnancy, birth, and mothering, as well as in representations of the acts, and this aesthetic relates to sensation and emotionality. In Western philosophy, the sublime has long been a topic of interest to the field of aesthetics, finding a particularly fruitful point of emergence during the age of the Enlightenment. It was at this time that male philosophers such as Immanuel Kant and Edmund Burke in Europe became interested in the inability of fully grasping the concept of greatness as it exists in nature and the human experience. Contemporary American philosopher Sheila Lintott has explored male conceptions of the sublime found in these works by European male philosophers. In her 2012 chapter, The Sublimity of Gestating and Giving Birth, Toward a Feminist Conception of the Sublime, which is part of a volume that she co-edited, Lintott describes these conceptions as masculinist, understood in terms of mental, emotional, and psychological strength, resulting in a merging of negative and positive emotions. Turning her focus from experiences of the sublime in nature, Lintott develops a theory of the sublime in a feminine context. She explains how in the case of those who give birth, for example, the sublime is an embodied experience. This experience is visceral and involves bodily strength and physical sensations, as well as psychological fears. Lintott's work helps to lay the groundwork for a feminist conception of the sublime as based on gestation and the giving of birth. Referring to Iris Marion Young's description of the doubling of the pregnant subject from Young's 2005 journal article, Pregnant Embodiment, Subjectivity, and Alienation, Lintott looks at an area of the sublime in gestation, which is the greatness or magnitude felt by those who are pregnant when they both contemplate and feel the way in which one body is enveloped within another during pregnancy. Quote, while pregnant, an entire person, a human being, once potentially and then actually, is embodied within a woman's person. Full recognition of this embodied magnitude involves a woman recognizing she embodies not just another life, but a wholly other life. A being who will want things she does not want, will do things she would not do, will believe things she thinks are false, will hate things she loves, will love things she hates, will, in sum, be not her, though presently this being is her, while simultaneously being not her. End quote. The pregnant self is never entirely one person nor two, but exists in a liminal space between two beings. Jonna Bornemark also aptly describes this doubling of the pregnant self in her chapter Light Beyond Individuality. Quote, the mother is being touched and touches the touching. As the hand responds to the kicking foot, there is no longer only an experience of one's own body. Instead, there is a meeting. The kicking foot is experienced as experiencing. And as an experiencing is experienced, a response is immediately there. The hand that is moved to the belly is probably a universal gesture. There is a responsibility standing by, end quote. This experience of the pregnant self is physical, but it is also intellectual and emotional. In Two in One Body, her contributing chapter to Bornemark and Smith's anthology, Joan Raphael Leff adds that the pregnant subject is, quote, not merely the empty container for an undifferentiated embryo, but a sentient woman who emotionally registers affective meanings of this specific conception and of her tethered state, end quote. Part of maternal subjectivity is emotional, and these emotions are intimately bound to the aesthetics of embodiment as the pregnant subject both physically feels the changes and processes of her transformed body and experiences thoughts and emotions related to those feelings. Lintott explains the ambiguity of certain physical sensations experienced during pregnancy due to the doubling of the pregnant self. For example, is a certain sensation experienced in the region of the womb one of the pregnant mother being kicked by the fetus or of one's own gas production, she asks. Integral to the experiences of pregnancy and birth are the drastic physiological and anatomical transformations of the body that those who are pregnant undergo. These changes impact everything from brain, cardiovascular, respiratory, and digestive functioning to weight gain, breast enlargement, skin pigment and condition, hair and nail condition, and muscular and skeletal alignment. Hormonal changes during pregnancy also have an additional impact on body and mood. While many of these changes are fascinating on a scientific or observational level, there's also an aesthetic dimension to the way that they are experienced by those who are pregnant. Feeling a fluttering in one's womb for the first time, which occurs when fetal movement takes place within the uterus and usually begins during the second trimester of pregnancy, a phenomenon known as quickening, for example, has a quality of sensation unlike any other in the human experience. Some who are pregnant describe it as a sensation of a butterfly's wings flittering and delicately touching the internal sides of the womb. Braxton Hicks contractions, known as false or practice contractions, felt during the second and third trimester and named after a British obstetrician who identified them during the 19th century, also have a unique aesthetic quality to them, bringing the pregnant woman or pregnant person's attention to a tightening of the uterus. In the case of my own two pregnancies, this tightening felt almost as if a thick, invisible band were simultaneously pressing and pushing the bodily region of my womb, but in a rhythmic way, similar to how I imagine the pressure between tectonic plates growing and releasing as the Earth's plates shift. Lintott describes the sublime as, quote, a complex experience located where negative and positive emotions merge in a precise combination to make one's own mental, emotional, and psychological strength particularly salient. The overall experience is usually construed as positive, but the route to this special satisfaction involves fear or frustration, even dread, end quote. In many of the bodily experiences just described, including quickening and Braxton Hicks contractions, Lintott's description of the sublime is accurate. Similarly, other fetal motion experienced during pregnancy, which can include kicks, jabs, and rolls, can be simultaneously exhilarating and frightening. In some cases, often captured in photography, the fetus's foot or hand pushes strongly against the uterus, showing its impression on the outside of the pregnant woman's belly. This visible marker of the internal body contained within the pregnant body is both felt through sensation and experienced emotionally, sometimes even by a partner who bears witness to the event, which is at once typical in pregnancy and extraordinary. The act of giving birth can take many forms, especially in the modern world, where technological and medical intervention is common. And yet, in all those forms, there is an aesthetic quality to the experience of giving birth. In the case of an unmedicated vaginal birth, the physical act of the newborn crowning from the vulva coincides with an aesthetic experience found both in the sensation of feeling a baby crowned from one's body, as well as in what may amount to a multitude of emotions experienced by the birth giver as she releases a new being into the world. Similarly, there is a physicality, emotionality, and phenomenology of what it is to be a mother. And as in the cases of being pregnant or giving birth, these aspects of mothering entail an aesthetic dimension. Mothers who breastfeed their child may experience the sublime as they watch in awe as their breasts transform, enlarge, and serve to feed their children. Mothers, be they biological or adoptive mothers, as well as fathers, also experience this dimension because it intersects with caregiving of the child, be it in feeding, bathing, soothing, playing, or any other aspects of mothering. These experiences carry with them sensations and emotions that on occasion are aesthetically profound. Art about the topics of pregnancy, birth, and mothering also carries with it an aesthetic dimension. These artworks may be aesthetically appealing in their own right, regardless of their subject matter, pleasing the viewer's eyes through their shapes, forms, and colors. I am not talking about that aesthetic dimension, however. I'm interested in looking at the way that art about these topics captures sensation and emotionality in an aesthetic way through material representation. Responses to these representations may vary and could range from feelings of intrigue to disgust. The fascinating aspect of this form of aesthetic experience is that the viewer is not simply looking at a representation of pregnancy, birth, or mothering. They are instead looking at the feelings or sensations of the subject matter. French philosopher Gilles Deleuze wrote a book called Francis Bacon, The Logic of Sensation, which was about this topic, but as it pertains to the artwork of the 20th century Irish-born British figurative painter Francis Bacon. Deleuze was fascinated with the artist, and especially in how Bacon's paintings are not representative, nor are they simply expressionistic or atmospheric. Deleuze believed that Bacon was painting the physical sensations of the human body. Quote, sensation is that which is painted. The body, painted on the canvas, exists not so much as an embodiment of the object that it represents, but rather demonstrates the sensation of the body as it is lived, end quote. I have juxtaposed Deleuze's quote with one of Bacon's most famous paintings, titled Study After Velázquez's Portrait of Pope Innocent X, in which Bacon renders the Pope in an existentially horrifying fashion. This style marks many of Bacon's paintings, but it is a good example of how a viewer looking at this image may perceive of the bodily sensations of the person depicted as opposed to just observing an image of the Pope's body and person. American analytic philosopher Suzanne Langer's ideas on intuitive knowledge, human feeling, and sensory experience in aesthetics are also informative here. In Langer's 1953 book, Feeling and Form, A Theory of Art, Langer explained, quote, art is the creation of forms symbolic of human feeling, end quote. She describes a system by which art is an expression of feeling, which is construed through the faculty of human knowledge. Feeling is therefore, according to Langer, part of knowledge. Artist Jenny Saville, who cites Francis Bacon as a heavy influence on her work, transports this method of depicting sensation and feeling into the realms of pregnancy and motherhood. Well known for her large-scale figurative paintings of nude women, Saville is a contemporary British artist who began to explore themes of maternity after becoming a mother herself. During the first decade of the 2000s, Saville sketched and painted several self-portraits and pieces related to the theme of mothers and children, in which she depicts herself holding her two infant sons. Influenced in part by Leonardo da Vinci's monumental Renaissance cartoon of St. Anne and St. John the Baptist, Saville's massive work, The Mothers, shows her seated, naked, and grasping the two babies on her lap, both of whom are all also naked, and squirm from her. As in Savile's other works, the charcoal lines of her sketches and colors of her paintings produce a dynamism through which the artist captures the physicality, emotionality, and phenomenology of what it is to be a mother of young children. In her sketch titled Reproduction Drawing 2, also influenced by Da Vinci, we see Savile depicting the motion and frenetic energy that mothers experience when caring for a young child while also heavily pregnant. Savile's artwork about motherhood and pregnancy have brought these themes to the arena of high-end museum culture, not an easy feat. The art acknowledges the physical work involved in mothering. I will now show 3 more paintings that I believe to capture the sensations and emotions of birth, post-birth, and breastfeeding. First, we have Sarah Starr's painting titled Study for the Crowning, which is one of the best representations of a birth crowning that I've been able to find over the past 15 years. The woman depicted reaches down during the moment of birth to feel her baby's head as it crowns from her. Her face is relaxed, and with eyes closed, she appears to breathe deeply during the birthing process. The golden hues of the background color add to the warmth of the image. The image is calming, reminding the viewer that the moment at which a baby crowns can be a sensation of relaxed opening. The second painting is Amanda Gravette's 2007 painting, It's a Human Thing, It's a Girl, which is a self-portrait that Gravette painted after her daughter was born at home. While the colors and forms of this work are exquisite, the representation of fleshly post-birth experience combined with deep human emotion is remarkable. Gravette has described this to me in our correspondences. Quote, "This piece was about the universality of that elation post-birth, when you're so high from having just birthed and received your child. I wanted to show the otherworldliness or euphoria the mother often experiences even while her body isn't fully pulled together yet from the drama of the birth. The position of the figure was intentional to convey that sliding around feeling or looseness immediately after birth, when the body and one's control of it is in fact secondary to the experience. The body is often very vulnerable and exposed, but that is greatly overshadowed by the intensity of meeting one's child." End quote. The fleshly aspects of birth are still rarely seen in art, especially in painting, but back in 2007, when Gravette first painted this work, this type of representation was particularly hard to find. Gravette, aware of this at the time, notes, quote, "At the time of painting, I wanted to convey the rawness of birth. The blood and umbilical cord at the time were unusual in art or birth photos," end quote. These aspects enhance the viewer's grasp of the sensations and emotions of birth and post-birth. Finally, we have Alexandra Carter's work Fruition, a vibrant depiction of breastfeeding that brings the viewer into the sensations of nursing children. Carter, who grew up on a cranberry farm, paints the mother figure nourishing herself from a bursting bundle of luscious and colorful cranberries, adding to her representation of the sensations and emotions of suckling and nurturing depicted in the painting. This paper has explored the qualities of sensation and emotionality in the aesthetics of pregnancy and birth, both in the actual processes of being pregnant and giving birth, and in the artistic representations of these processes. As the paper has claimed, it is often through these qualities of sensation and emotionality that the sublime is experienced during gestation and birth. The paper has also considered the phenomena of sensation and emotionality in the aesthetics of being a mother, biological or adoptive, especially in the case of mothering infants and toddlers. Exploring the aesthetics of pregnancy, birth, and mothering that emerges through the sensations and emotions felt during these events, the paper has also provided a parallel study of the aesthetics of artistic representations related to these same phenomena. And I just wanted to conclude with a quick note to let you know that I've recently published a new book which concerns art and birth. It is titled The Visualizing Birth Book, and although it includes some scholarly material based on research I've conducted over the years on pregnancy, birth, art, visualization, and mental imagery, It's primarily written as a birth manual for those who are pregnant. And so anyone interested, you can check out my website or my Visualizing Birth website. So thank you. That's all.
Thank you, Anna. That was wonderful. So much here. It's wow. We have a few minutes. Yeah, we have 7 or 10 minutes for questions, if anybody has questions. I just wanted to thank Anna because the way these papers overlap and intertwine, and it keeps the last papers are making me think of the first, and it's just been an amazing experience. So thank you for doing that so beautifully. Now we want to return to the artists and the nurses and everything and bring it all together. So I just wanted to thank you for that. That was amazing. Any questions? I have, I guess, a general question for all of our last speakers about the Sublime. There's so much going on here, and I'm wondering how we take this out of the realm of philosophy, this understanding of the Sublime, which you all were able to, and the aesthetics of gestation and all of those things that come together and bring it into the lives of whether it be midwives or women giving birth, or how do you bring that, or teaching as we have this idea of pedagogy also. How do we use this for artists, for mothers, for nurses, etc.? Have you thought about that? Because I know some of you mentioned environmental studies. Yes, Beatrice.
So we have someone here, Birgit, who is going to present tomorrow, and that's exactly her project. She is an artist and midwife and philosopher, and she just has published a book in which Barbara and myself were also collaborating with her, and that actually is a book intended to bring these ideas to midwives. So it's actually especially precisely geared at midwives. So that's a really good example. And thank you, Birgit.
I will look for the book.
I think that the artwork itself, it can be used as a way, especially in the medical arena, to bring that artwork right into spaces of birth. And there's been some research on this. I know there was a pretty large scale study about 10 years ago. I think it was the University of Michigan, but they started going into, and also in the UK, they did one similar where they were using artwork in different spaces in the hospital, but to see like how this would help with, in some cases with birth, they went into maternal wards. And so that I think the artwork itself can be used as like a pedagogy for midwifery and the nursing setting, and also for academics as well.
Thank you. Barbara?
Yeah, yes, I'm here. Yeah. Yes, I think that with nursing and with Waferi, there is a sublime in the dimension of care, because they are face to face with the fragility and the mystery and intensity of human life. And in this moment, so practically care is just more than your job. It's like it's not a clinical practice. It's something more. It's very much an ethical and embodied experience. So I think the sublime, you can find it there, because there is birth vulnerability, and yeah. So this is for that, and for pedagogy, if we look at the idea of the sublime inside, not just it's not outside. So it's the idea that maybe it's just it's not my idea. Lots of philosophers spoke about this. It's the body is not an obstacle to knowledge, but it's a site of knowledge. and we forget that a lot, no? We fight it. And then in general education, you know, I was a teacher, started as a teacher, primary school teacher. Just they want always this abstract reasoning, while the embodied experience is so important, especially for kids. And then I think also the idea of vulnerability, no? We, it's very important. We are always scared of being vulnerable, or you know, if we look at the case studies, no, and then if you look at when we say yes to pregnancy as well, no, we are really kind of, you know, we don't know what is going to happen. We are troubled, we are questioned, but then we consent, and this is um, uh, so we transform not because we want to control. That's the fact. We leave the control out, and the transformation obviously you have to control yourself. You know, control. Why not? No, it's not that. The transformation starts when you say no. I'm open. I'm not, you know, and then I bring life, you know, in different ways. So, and so that's the thing, and also the idea of relationality. I think it's very important because yeah, when you're pregnant, and we need the dialogue with a different part of ourselves, with the reception. We have transformation, and yeah. So in general, when we say yes, you know, to openness, we are fragile. And sometimes when we say yes, we are fragile, and we are open, everybody says, okay, you are passive because you said yes. No, it's the opposite. It's like, you know, we see what's black we become white, what's white become black in the history of philosophy. We just have to start saying, no, it's the opposite of what you think. So um, yeah, and then there are all the things that you know, the pedagogy has been telling us for ages, that you know, what if is in front of you, they are not a receptor, but you know, they have the agency, and you have to respect that there is transformation, but there is never you know, what is inside is never erased, and you shouldn't erase. Yeah, that's it.
Thank you. Any other questions?
I just wanted to make a mention about Christina's work on the process, because I think that especially in like the capitalist modern society that we're living in, and I think maybe Beatrice kind of talked about this too, is that, you know, we look at like an object, like a completed object, as what's important, whereas the process of things in our world, including pregnancy and birth, but we could even broaden that just to like your life, your everyday is important, not like, you know, these markers that we live by in our lives. And so I think that she was kind of speaking to that with the importance of noticing the process of the pregnancy and not just like the final baby being born, and that's all that matters.
Yeah, and the link to creativity and the environment and all that was really fascinating. It's something I hope can be delved into more deeply. It's giving me lots of ideas for work with my students, so I'm appreciating it.
And
Yes,
I just put one image. Sorry, Christina. This is because Barbara had been talking about, you know, the images of the Annunciation, and then this is just an image of Mary giving birth. I know the artist, her name is Sarah Starr, and actually the image was not seen as profane. I believe a Catholic college bought it. So, and she said that actually it was more evangelicals who did not like her work, but the Catholics really enjoyed her work. So it's a very kind of visceral image of Mary giving birth to Jesus. So anyways, I sent it to you, Barbara. But Christina, go ahead. You were going to say something.
yes, I just wanted to agree with you because I think this notion that I introduced, the gestational aesthetics, it's somehow confronting this capitalist tendency to privilege outcome and productivity and efficiency and to focus on results. So very often we attach value to the outcome, to the final result. But I think this notion of gestation puts a focus into development. And also I like this idea of care and this waiting as not a passive state, but as something that is correlating to care and to this process of becoming. So yes, I think this is very interestingly situated against the capitalist discourse.
Yeah, thank you for that. So I guess that's it, right, Marianne? Any other last comments?
I don't see anyone else, but I really want to thank you again for letting me be part of this, because there's so much I think we've all been enriched by this morning. And I look forward to seeing what everybody keeps doing. Thank you so much.
Yeah, so we can end today's session, and for day one we'll be over. Beatrice, I was just going to say for those who are tomorrow, I am not going to be present in the early sessions because it'll be about 1 a.m. in California. But Beatrice, who is here with us, she's going to be the room facilitator, and she's also going to be moderating. But go ahead, Beatrice, you wanted to
Yeah,
say
I just wanted to ask maybe there could be a mailing list or something so we can actually contact the other speakers, because I think there's just so many synergies and beginnings of conversation that would be great to be able to like pick them up after even after the session.
Yeah, definitely. Yeah, I can send out the emails.
Sounds great. Thank
Yeah.
you.
Well, thank you, everybody. And I guess that we can close out if there are no other comments. We have another 2 days coming up that are going to be beautiful. So we're looking forward to that. But thank you for all coming to this first day, which I think was beautiful and worked out really well with all these papers together.